Good morning, dear colleagues. First of all, apologies for the delay. We are starting our event, the second National TB Dialogue, and this year it is dedicated to the fulfillment of the political obligations and declarations of the UN by Ukraine, the political obligations of Ukraine to fulfill the programs in order to combat TB. In the first panel, the keynote speech belongs to participants of the state government sector because the government's position is the most important. I kindly give the floor to the Deputy Healthcare Minister of Ukraine, representative of the Head of Public Health Care, Chief State Sanitary Doctor of Ukraine, Igor Kuzin, please. Dear colleagues, dear friends, our online participants, our audience in the hall, first of all, warm greetings to this national dialogue because due to the quarantine limitations, it's very difficult to organize various mass events, but vaccination allows us to do this. I'm availing myself of this opportunity to promote vaccination and to warn you of COVID. TB issues are still relevant, regardless of what is going on in the world currently. And nowadays, many countries have started to fall back behind the UN goals globally and regionally. And the progress that had been achieved several years ago has slowed down recently because many medical specialists, many doctors have been relocated due to COVID and repurposed to fulfill the COVID, to combat COVID. So secondary auxiliary services are suffering. So fighting tuberculosis should be on a constant agenda of ours, and we also have no right to forget that Ukraine undertook certain political international obligations. What is the purpose of the national dialogue? When we speak of international obligations, we don't only mean an international document that we are signatory to. This is the common obligations and responsibility of the country to reach certain indicators. Sometimes people from public healthcare system need to remember, they need to hear what's going on, hear the patients, hear representatives of other government authorities and the ministries and representatives of NGOs. So the national dialogue is aimed, first of all, to give these formal public consultations to discuss the most relevant programs. The intersectoral cooperation mechanism is the key one to achieve the SDGs, including fighting the TB pandemic. And in fact, this intersectoral cooperation mechanism allows us to mobilize all of our resources, ideas, possibilities, and reassign them, relocate them in critical moments, and create this pool of like-minded specialists to fight TB together. I'm pleased to see representatives of NGO community, of government sector here, representatives of other relevant ministries and institutions, and I'd like to see us speak to each other openly, discussing our current problems. Special thanks to the fact that while we are discussing TB, we're not only talking about treatment, prevention, and diagnostics, but also stigma and discrimination. We're also discussing protection of human rights and fighting stigma on the level of medical workers or generally in the society, and human rights monitoring and non-violation of these rights is critical because we can give people great infrastructure, great treatment, but at the same time, patients will feel enormous stigma and psychological pressure. So avoiding that is also critical, is also of key importance. Today we also need to discuss this part of the problem as well and pay attention to it. We have a number of presentations today. One of them will be mine. So I'll be back to you to evaluate Ukraine's progress on implementation of political declarations. And during my presentation, I'll be able to cover the basic components of our today's situations. So greetings to the opening of the national dialogue. For the upteenth time, I call you to a constructive dialogue, and hopefully at the end of the day we'll leave with a clear understanding of where we're going, which zones are critical for us to overcome the TB epidemics in Ukraine and in the world. Thank you, Mr. Igor. As you know, the National Healthcare Service of Ukraine is the key partner of the Ministry of Healthcare to fulfill the obligations to fight TB. So now the floor to the head of the National Healthcare Service of Ukraine, Natalia Gusak. Good afternoon to all of the members of the second national dialogue. When we're talking about the implementation of SDGs, for me personally and for the National Healthcare Service, it's a chance to be a part of something bigger and to solve global problems. Now, when you are solving problems with the availability and accessibility of healthcare for TB patients, we are talking about our obligation as an institution. We're not just funding the healthcare providers and monitoring the quality. We are obliged to join this community that is implementing the SDGs in Ukraine as well, concerning high quality healthcare and solving the TB problem globally and in Ukraine. The NHS, starting from 2020, has been covering all levels of healthcare services with the programs of help to tuberculosis patients. Nowadays, in the Medical Guarantees program, we have the opportunity to provide diagnostics, inpatient treatment, and accompanying at the primary healthcare level. It seems to me that quite recently we've been discussing with this issue with the NGOs, the tariffs and the requirements of everything related to helping TB patients are the most dynamic elements of this program of NHS. This is thanks to a constant dialogue to all stakeholders. We constantly work with the Ministry of Healthcare, the NHS, the NGOs, the healthcare providers. And every year we can see how we make it better, starting from the requirements and ending with a tariff, providing healthcare to such patients. And taking that into account, from what I've seen on regional level, I enjoy seeing that one of the first packages of medical assistance, as Mr. Igor says, covers the intersectoral cooperation, was helping people who suffer from tuberculosis. So in the new specifications, we have included the requirement of tolerant attitude to the patients and working with the medical experts at regional levels. Our today's program and our today's challenges that we will discuss and to move forward is cooperation between all levels of medical services, the scenarios on the regional level, and assistance to TB patients. And in close dialogue between all institutions, all public organizations, and all stakeholders, and with the assistance of the international expert opinion, every time we keep moving forward on solving TB problem in Ukraine, and I can assure you that the NHS will continue being a good partner for making high quality medical services to each patient in a timely manner and in full extent. And in this framework and within this dialogue, I am glad to say that the NHS is not just a cost sheet keeper for solving this problem. We are the body that is shaping policy together with you to to overcome TB as quickly as possible in Ukraine. Thank you very much. We also have here the head of the National Social Service of Ukraine, Vladislav Mashkin. You're well aware that we love talking about social services, that tuberculosis is a socially threatening disease, and these services need to be implemented together with the basic medical services. So we're giving the floor to the head of this service, and he'll be with us via Zoom. Good afternoon. First of all, I'd like to greet all participants of the second national dialogue. This is a truly important event, great format for exchange of opinions, to create synergy for all participants of this process, in order to overcome tuberculosis and all related problems. The social element in this work is extremely important. The mission of National Social Service here is organizing the work of the amalgamated communities in such a manner to make the services as accessible as possible, so that all employees of the social service locally are trained to provide social medical services correctly and in a timely manner, and that everyone who needs those services has open access to them. We train social workers. We monitor the situation with the budgets of amalgamated communities, specifically the budgets aimed at social services provision. These are the responsibilities of the amalgamated communities, and they will be the definitive factor for the success of this work. We are ready to join any projects implemented in these directions and be a reliable partner to everyone for our primary goal. Thank you for the invitation, for the attention. Dear colleagues, I would also like to give the floor. I'm happy to give the floor to the representative of the People's Deputy Sector. We have a great example of cooperation with the parliamentary members of parliament. We have an MP platform on tuberculosis. We have a lot of joint events, and we have Olga Stefanishin speaking to us. She is Ukrainian MP representing the Healthcare Committee. Ms. Olga. Good afternoon to everyone. Can you hear me? Yes, we can hear you well. Greetings to all participants of the forum, and thank you for this invitation very much. I represent the National Healthcare Committee, National Assistance and Medical Insurance in the Ukrainian Healthcare Committee, but I worked within the NGO sector for a long time, helping patients and improvement of patients' communities. I walked along this way, and I helped implement the reforms as member of Ukrainian parliament. First of all, in the parliament, we do everything that's possible to extend the funding to the medical sphere, following the law of Ukraine that the medical guarantee program should be supported by 5% of the GDP. And for 2022, there is an extended funding of medical guarantees program, but still, we consider that's not enough. We will continue fighting for the decent funding of the medical sphere.
It's not a secret for anyone that Ukraine inherited a cumbersome and inefficient system of anti-tuberculosis service, which is a heritage of the Soviet Union. And this is one of the reasons why we have such a rapid rate of spread of tuberculosis, which is resistant to medications. And I think this is one of the problems that we all have to address, and Ukraine is currently making the steps in the right direction in order to reform this system. This is not an easy process for us, but I have to acknowledge all the steps made by the executive branch in order to implement this reform. And we've demonstrated an impressive growth and development of the community of patients and civil society organizations that give you an example of how they can go about developing the system for combating the spread of tuberculosis. But I think that one of the most important factors that will help us to reform this system is a close cooperation between the executive and legislative branches. And as a representative of the Committee on Healthcare, I confirm that our committee is ready for revising legislation in the sphere of TB prevention, and in cooperation with the civil society organization, with the Ministry of Healthcare and the Public Health Center. So it is my sincere hope that next year, 2022, we will revise and update the legislative framework to make it more efficient in terms of ensuring implementation of the healthcare system. Thank you very much for your attention, and I wish you a rewarding work today. I'll stay connected online and will be with you, and I hope that the results of this forum will enable us to make a powerful leap forward. Olga, thank you very much for joining us and for your time and your words. And on our side, as partners, we confirm that we stand ready to continue our work in the areas that you mentioned. Then we have a confirmation that we have a Deputy Minister for Social Policy with us, joining us online. And you understand that it is extremely important as well, because I will not waste any time explaining how important our partnership is. So if you are with us, the floor is yours. Dear participants of the second national dialogue, on behalf of the Ministry of Social Policy and the Deputy Head of the National Council for Combating TB and HIV, Marina Lazebna, I would like to welcome all of you, because tuberculosis is no longer a purely medical problem, because it presents a threat for the society in general, reflecting the social condition of the country at a level, describing the well-being level of the population. One of the most important factors of socially oriented policy in any country is its attitude to solving and tackling the problem of socially vulnerable people who found themselves in difficult life circumstances. And of course, we are all facing the risk of being infected with TB, but special attention should be paid to legislation, to people who, according to the legislation, belong to the vulnerable categories of the population, because timely checkups and prevention activities can help us avoid increased numbers of people infected TB. And educational activities are especially important among parents and other categories working with children. We have to tell them about the ways of infection and the importance of prevention, because when people understand how they can be infected and how they can prevent that, they will be better equipped for taking care about themselves and taking care about the health of others. And we have a wide range of a network of institutions for homeless people, for former prisoners, people with disabilities, elderly people, and others, including people with mental disorders. So these are social groups that are most vulnerable for TB infection. And the major task for work of these facilities is to provide social services as well. Mr. Vladislav mentioned the importance of their activities and developing social services for these categories. And then another important step is awareness raising and developing tolerant attitude to vulnerable categories of the population. And then when we provide social services, we should not only focus on people who stay in respective institutions, but we are developing this service for additional period of rest for people taking care of infected people or for relatives with various infections. And we also introduce social support for such people in strict adherence to these national standards. These are all basic social services that have to be provided at the community level, but not less important is the social service for people with low income, which is an in-kind support, such as provision of food packages and hygiene packages to them, sanitary and hygienic means. So it is also an important part of social work with elderly people. We know that the overcoming this problem should be comprehensive, and in order to combat the spread of this disease, we have to involve all the stakeholders and everyone related to that, from central level, local governments and civil society organizations. And the system and the Ministry of Social Service is open to adopt new methods of works and ways of works, and we hope that it will be important, first of all, for the citizens who require our support and assistance. Thank you for your attention. Mr. Boris, thank you very much. And now I would like to give floor to the final speaker from the specialized institution state facility called Center of Public Health of Ukraine. And I would like to give floor to the head of the Department of Coordination of Treatment of Tuberculosis, Yana Terleeva. And Ms. Terleeva today is one of the principal moderators throughout the forum, so we will meet her in different capacities during different sections. But now I would like to give floor over to you for your opening remarks. Welcome, dear participants of the National Dialogues, guests and invitees. And I would like to say that today we have to fight for moderate indicators of TB infection. But another important task for us is to focus on a person affected by the TB problem, the people with their fears, with their rights and their need for our support. And the Public Health Center is a state enterprise subordinate to the Ministry of Healthcare, and in fact we perform the functions of the implementer of the National Anti-Tuberculosis Program. And thanks to our coordinated activities with partners, donors, civil society community, we've been able to achieve a lot in terms of improving access to assistance. Even people with resistance form of the tuberculosis have access to prompt diagnosis system, and we've introduced them at the levels approximated to the patients. And in December, we will deliver approximately 113 systems for diagnosing tuberculosis to the patients. Then we also developed the standards of provision of tuberculosis services, which are completely in line with the international practices and are evidence-based. We introduce innovative medications, and literally yesterday I read news that the most innovative medication, Pretomanid, was registered by the Ministry of Healthcare, and I'm sure that they will take all necessary measures in order to make this medication available to the patients who were affected by TB infection. But our objective is not only to go closer to our patients with providing treatment and possibilities for diagnosis, but we are also focusing on providing social and moral support to our patients. And this is the goal of our today's event. And we are calling upon all ministries, departments, donors, and partners to consolidate their effort in order to overcome such a socially important problem as tuberculosis. And we are ready to assume more responsibility, and we are calling upon you to be very responsible in your actions at all levels. And that is why we're deepening and strengthening our interdepartmental cooperation. So I encourage you to be very active in overcoming the problem of tuberculosis in order to achieve tangible results that will bring us closer to eliminating the problem of tuberculosis. Thank you very much. Dear colleagues, this is the end of our opening part, and we will proceed with our sessions. Welcome, dear colleagues. Morning to everyone, and I will start my role as a moderator and facilitator. And before giving the floor to Mr. Kuzin, I would like to remind everyone that our event today is held on a very interesting day, because tomorrow is the 10th of December, which is the 73rd anniversary of adoption of the General Declaration of Human Rights. And it's also interesting because we came together here on the eve of this anniversary, holding our event here, because Article 25 of the General Declaration of Human Rights describes precisely the things we are going to discuss with you today. And before coming closer to presentation of Mr. Kuzin, I would also like to remind you that at a high-level meeting of General Assembly of the United Nations, the UN Declaration on Tuberculosis was adopted, and all UN member states assumed the responsibility to overcome tuberculosis by 2030. And in Mr. Kuzin's presentation, we will learn about the measures that were taken to implement those commitments, and we will hear from him how we're going to move forward on this way. So, Igor, over to you for your presentation, review of the Ukraine's program in implementation of the political declaration of the United Nations on tuberculosis, consolidating effort in overcoming challenges. Okay, thank you very much. Now you can see my presentation on the screen. And dear colleagues, first of all, I would like to thank you again for your participation, and let us start from the very beginning, which is the definition of Ukraine's place in the global world and its position in the report of the WHO. Unfortunately, Ukraine belongs to top 16 countries with the highest share of decrease of registered instances of tuberculosis. You know that COVID had a negative impact on the program of combating tuberculosis. In 2021, the number of deaths expected from tuberculosis is way higher in these 16 countries that were included into WHO report. And by 2022, the number of instances of tuberculosis in these countries is expected to exceed the level registered in 2020. So Ukraine, unfortunately, unfortunately has a lot of challenges that it's faced and that we have to join our effort in order to overcome them. And if we look at the basic indicators describing the situation with tuberculosis, is when you relapses. So there were 230,000 instances were registered over the last 9 months per 100,000 of population. And if we look back at 2020, 2021, we can see a significant decrease of these indicators of this number. And it's a purely technical reason, because the system is overloaded and it does not give us a possibility to provide timely diagnosis of the instances of tuberculosis. And this is exactly the problem that we're going to face in several years, and it will affect efficiency of treatment when people will be diagnosed at a late stage and when patients did not have access to timely treatment. So tuberculosis is one of the major cause of deaths worldwide. And every year, this number decreases by 8% on average. And you can see a Ukraine picture here. So the number of deaths caused by tuberculosis was 7.4 in 2021 compared to HIV/AIDS combined, which is 2 and 3%. But COVID pandemic undermined the successes that we achieved in terms of fighting tuberculosis at the global level. And for the first time over 10 years, the numbers began to grow.
Unfortunately, every year we lose 3,000 patients that die from tuberculosis, and in most cases we could have prevented their deaths. If we try to describe the TB problem, the key is the relations, the correlation with social determinants, the revenue level, the social support, education, early stage development of children. These factors define the quality of living. And some groups of people, especially those with lower socioeconomic status, are forced to live and work in less favorable conditions and have more morbidity factors. Intersectoral measures to solve the social economic factors of TB. There are several of them, but I'd like to draw your attention to the key ones. The non-discriminatory, legally supportive legislation that gives us a society that is free from discrimination stigma. Implementation of a general anti-poverty and social security programs, the second super difficult and super important component. Next, the socioeconomic conditions for migrants, and fourth, promoting healthy nutrition, a healthy lifestyle. When we start analyzing these social determinants and risk factors, we start seeing this complex picture. To mitigate the morbidity and reveal the hidden cases of TB. In September 2018, the first General Assembly high-level session on TB took place, and on October 10th, 2018, they signed the corresponding political declaration. I'd like to quote two key articles that are closely related to what we're doing now. Paragraph 48, we undertake to design and strengthen the national strategic anti-TB plans that will cover all the necessary measures to fulfill the responsibilities under this declaration. Paragraph 49 is an address to the WHO with a request to design intersectoral mechanism of accountability and ensure its implementation not later than 2019. So the global accountability under this political declaration are being implemented in Ukraine in the following manner. First of all, the global accountability, the global requirements from the tuberculosis liquidation strategy of WHO and the political session, anti-TB session, that became the foundation for the national anti-tuberculosis program with a corresponding set of events. And these two documents were approved in 2019 and 2020. Also, the national anti-HIV tuberculosis and virus hepatitis until the 2030 strategy was approved in 2019. Accordingly, there's a number of documents and key national reports on sustainable development for Ukraine. It's usually published once every 2 years, and the main decree by the president that sets forth the implementation of global accountabilities of Ukraine are supported by the president's decree for SDGs by Ukraine until 2030. There are also documents that are pending approval. The action plan for implementation of 2030 national strategy, and drafting a new tuberculosis law that is supposed to be the key fundamentals to run this anti-tuberculosis strategy. The strategies that we use in Ukraine is an adaptation or a local rethinking of regional and global strategies on fighting tuberculosis. The key documents were the SDGs 2016-2030 and the strategy of WHO, putting an end to tuberculosis until 2035, and these two documents became the fundamentals of the National Anti-Tuberculosis Medical Services Strategy and the State Strategy on Fighting Tuberculosis and HIV. What are the main purposes that we are setting on the national level? There are several of them. The strategic goal, strategic goal number 3, decrease in the morbidity and mortality of tuberculosis, and 3 sub-purposes: the improvement of anti-tuberculosis system, the increasing the success of detection of tuberculosis, and decreasing the number of tuberculosis cases of resistant form. What we have now, also based on tactics, is a decrease in morbidity by 80%, mortality by 90%, and increase in the effectiveness of treatment of all TB forms of up to 90%. But the general purpose for us all is to end tuberculosis in Ukraine until 2030. This is an ambitious goal, and the mechanism of intersectoral cooperation must be the fundamental for making that happen. Intersectoral cooperation, of course, cannot be put into one slide because the number of partners is huge. There are a lot of them. If we're talking about the state level, the key thing is the Cabinet of Ministers of Ukraine, now the central executive bodies, the National Council on TB and HIV infections, that is an aggregated and consolidating body that helps representatives of the central authorities to do the decision making. Also, the Ministry of Healthcare that does political support and approves policies, anti-TB policies. On the national level, we also have quite powerful 2 institutions: the NHS that we've already mentioned is a national coordinator of a TB program, and the National Healthcare Service that is a central authority that is responsible for the funding of medical institutions. A huge infrastructure on the regional level is functioning right now. It's optimized, reorganized, and it's now capable of providing the entire package of high-quality medical services, regional physiopulmonological centers on the regional level that fight tuberculosis, and of course they cooperate with NGOs, with private communal medical services and healthcare providers, and regional physiatric communities to prevent tuberculosis. I've already mentioned that when we say about intersectoral cooperation, we need to focus our attention on eliminating certain barriers that disable us from fighting tuberculosis. And the key directions to fight are stigmatization, providing confidentiality, the right to work, education, respect to personal, private, and family life, access to medical services. Also, the problem of non-controlled territories is relevant for Ukraine. Access to the supportive and medical services for TB patients. And these are the key spheres for the national level as well as the regional level and district one. We are using consultative and advisory instruments or platforms to exchange information quickly and communicate quickly. Of course, the key to groups are the National Anti-TB and HIV Council that brings together almost all stakeholders of this process, and it was created in 2021 it created an interfractional community, the parliamentary platform to fight tuberculosis. The key partnership is End Tuberculosis Ukraine, that unites these two platforms and helps implement the policies and results and strategies and achievements that are approved at these two platforms. So implementations of intersectoral cooperation and accountability mechanism. Ukraine has been moving along this path, of course. And the body that's responsible is the National Council of Counteracting Tuberculosis and HIV as an advisory body of the government. And at the sessions of that council, they have approved a number of decisions that help implement that mechanism. On January 28th this year, they've decided to implement intersectoral approach on the implementation of political declaration. This will be assigned to the National Council. It was their first decision, and provide an initial assessment of a situation on intersectoral cooperation and present that at the next session of the Council. On June 22nd, this assessment was finalized, presented, and approved at the corresponding session of the National Council, and they've also created proposals to the national roadmap based on this assessment. Also, on March 17th, 2021, hearings of the Profile Committee of the Parliament took place, initiated by a wide circle of our partners. Our special thanks to the MPs for bringing attention to TB problem in Ukraine, for finding the time and initiating and helping organize this platform. Based on this session, there was an address sent to the presidential office, and the topic was to launch on the 24th of March an annual High Council in the Office of President on the TB topics, involving all stakeholders to discuss the implementations of anti-TB measures. And the key philosophy was that these annual sessions, higher level sessions, would see the highest political decision making, giving us the opportunity to support these vectors and directions of development. Also, the Cabinet of Ministers have approved creating the national roadmap for intersectoral cooperation and accountability within the framework of the political responsibilities that we had approved. This roadmap is presented here on this slide. The decision of the National Council, as I've mentioned, January 2021. The hearings at the committee also took place. Also, the consultations were held, and the preparation of the roadmap with the plan and approval of the decree of the Cabinet of Ministers is planned for December 21st, March 2022, pending approval. And the institutionalization of coordination mechanism is within the framework of the higher level council session. And in 2022, we'll also initiate a high-level hearing in the parliament or in the presidential office to monitor the progress on fulfillment of the international responsibilities. If we summarize the fight and the challenges and our progress in fulfilling our accountabilities, the international responsibilities are already included in our national legislation, but mostly these include medical events. Meanwhile, intersectoral cooperation and accountability demand the dialogue, require a dialogue to distribute the roles and the responsibility of each stakeholder.
There is also a great demand for high-level leadership commitment in order to ensure implementation of international obligations assumed by the state and by the Ukrainian government in order to consolidate effort of all sectors interested in joining this process. Then we should also provide incentives for all stakeholders for developing a roadmap for ensuring intersectoral cooperation at the level of the Cabinet of Ministers and identifying the areas of responsibilities for all involved ministries with respective financial commitment. And the last point I wanted to mention was implementation and the development of tools for ensuring responsibility of all stakeholders. And we've also developed basic recommendations, and I think that today, within the framework of our second national dialogue, we will be able to expand or revise them or develop new recommendations. So the first is to strengthen the role of the National Committee of ensuring sustainable funding and a high-level assessment through expanding the possibility for strengthening the capacity of existing institutions and coordination of their activities. Then second one is expanding, improving access to prevention and diagnosis facilities. Third one is coordination at the national level, coordination of effort of overcoming stigmatization and discrimination. Measures should also be taken to eliminate socially determined causes of tuberculosis within this framework of implementation of SDGs. This is a complicated task involving inter-department cooperation. And next recommendation is improving a legislative framework and elimination of discriminatory norms in legislation. I would like to acknowledge the effort of the expert team that worked at the level of the Center of Public Health, and they developed the first draft of the draft law of Ukraine on combating or preventing tuberculosis. And in the nearest future, we are going to start discussions to adopt it and to implement it as soon as possible, and we hope that these legislative amendments will be beneficial for the entire system. Then the next recommendation is to develop and implement the national plan of research and ensuring implementation of findings of this research when making managerial decisions. And the final recommendation is to recognize, acknowledge, and develop the role of civil society working with those people who were affected by TB infection. And in Ukraine, I'm pleased to say that the civil society community is very powerful, and it's the only one that's whose activities are based on their our ideas and perceptions. So this recommendation has good chances to be well implemented because we have ongoing cooperation with various organizations. And I think I should stop here and give the microphone to the next speaker. Thank you very much, Ihor. But before we give floor to the next speaker, we should ask our audience online and offline any questions or maybe comments. Yes. Ilya Zhakin, 100% live, Cherkasy, and regional representative of the center in Cherkasy Oblast. And I have a suggestion, rather practical one. So is it possible to get, for instance, involving the National Healthcare Service to organize similar meetings at the regional level with heads of local departments, regional departments, on developing the packages to be of provision of services to be implemented by the centers for providing of primary medical and sanitary assistance, because these centers in our practice, we see that not all such centers apply for receiving these packages of services, and this immense work that you carry out is a little bit not understood at a local level, and probably you should raise awareness about it. Thank you very much for your suggestion. It's very good, and we are going to discuss these issues with the National Healthcare Service, and I agree with you that it's extremely important to organize series of such meetings at the regional level, and I'm sure that the territorial offices of National Health Service will join us, and after this forum we will plan a schedule of these meetings. Thank you, Ilya. Colleagues, anyone, any questions or comments? Nothing online? Then thank you very much, Mr. Kuzin, for your presentation and information that you shared. So this laid the foundation for continuing our dialogue, so this information will be used in our follow-up conversations. And thank you very much. Let us move on. And we saw that one of the primary strategic partners in terms of ensuring implementation of commitments of the political document is the WHO. World Health Organization provides huge support, technical support to Ukraine for us to be able to move in the right direction and to speed up this process. And one of our important strategic partners is the European Bureau of WHO, and I would like to give floor online to Sayohat Hassanova, technical specialist of the United Program of Fighting Tuberculosis, HIV, and virus hepatitis of the Unit of Emergency Situations in the Healthcare Sphere and Infection Diseases of European Regional Bureau of WHO. And Sayahat will be talking about the prospects and key recommendations of WHO for implementation of the roadmap in Ukraine in the sphere of multi-sectoral cooperation. Sayahat, glad to see you, and over to you. Thank you very much. Good morning, dear colleagues. Can you hear me well? Yes, we can hear you very well. Thank you. Can you show my presentation on the screen? Yes. I would like, first of all, to welcome all participants of the National Dialogue on behalf of the Regional Bureau of the WHO, and I would like to thank the organizers for inviting me. It's a huge honor for me to be able to make this presentation for you, and I would like to congratulate Ukraine to the progress it made for in adaptation and implementation of the mechanism of multi-sectoral cooperation and accountability. And on my next slide, I will repeat some things, but again, I would like to thank Mr. Kuzin for covering a lot of the points I was going to make in my presentation, but I tried to respond to the request I received from the organizers, and I'm going to talk a little bit about the global commitments related to elimination to tuberculosis, and we have a little bit of background that I would like to share, and I was going to talk about new political commitments taken on by member states, and the milestones that were adopted at the high-level meeting. And I was also going to talk about monitoring and evaluation of the progress in implementation of global commitments. And we will talk a little bit more about the accountability mechanism and about the technical assistance that is provided by our bureau in this region, and Eastern Europe and Central Asia. I'm also going to talk about the objectives that were identified for implementation of global commitments and recommendations concerning monitoring and evaluation of efficiency of multi-sectoral mechanism of cooperation and accountability. Today, the previous speakers mentioned the importance of multi-sectoral cooperation in the sphere of tuberculosis, and these issues are reflected in the global strategy and commitments, and the WHO also developed a strategy for elimination of tuberculosis. It was adopted by all countries back in 2014, and these issues are also included into the Sustainable Development Goals that were adopted and reconfirmed in 2015. In 2017, during the first Global Ministry Conference on Tuberculosis, a political declaration on elimination of tuberculosis was adopted, and the ministers of healthcare of various countries assume there is a commitment to eliminate tuberculosis by 2030 and strengthen multi-sectoral cooperation for combating tuberculosis. So they approached WHO and asked it to develop a mechanism that would help the countries to adapt and adjust their effort in the sphere of cooperation and accountability. In 2018, during the first high-level meeting, a political declaration was adopted, and all member states, UN member states, committed themselves to achieve the global goals by means of intersectoral cooperation, and they asked the WHO to ask it to finalize development of the mechanism of multi-sectoral cooperation and help countries to implement this mechanism both at the global, at the national and a regional level. As you know, during that meeting, new political commitments were adopted, and I'm going to mention them on my next slide. So starting 2019, WHO developed and published the mechanism of multi-sectoral cooperation and accountability, and starting 2019, we've been providing coordination and technical support to the countries and partners at the global, national and regional levels, and we help them to adapt and implement it, and carry out monitoring and assessment of implementation of this mechanism at all levels. On this screen, you can see these new political commitments that were assumed by the countries at these high-level UN meetings on tuberculosis. By the end of 2020, the target point is to treat 40 million people, provide treatment and prevention activities for 30 million people, and mobilize a minimum $13 billion per year for combating tuberculosis, and minimum $2 billion annually for research of tuberculosis, which were very ambitious goals, and that requires multi-sectoral approach for preventing tuberculosis. On next slide, you can see the timelines that were identified for monitoring and evaluation of the progress in achieving the global goals. And the first key step was made in 2020 when the first report on the progress was presented at the meeting of the General Assembly of the UN, United Nations, but Mr. Kuzin said that unfortunately these countries are lagging behind in terms of achieving these goals, and again, multi-sectoral approach is extremely important here in order to address all the social factors and other determinants in affecting development of tuberculosis. And the report emphasized the need to deepen multi-sectoral cooperation of the countries for implementation of this mechanism. And in 2022, next meeting, a UN meeting, is planned on tuberculosis, which will envisage comprehensive assessment of the status of achievement of the goals that were identified in 2018. So the next year is the key year for identifying and assessing progress in achieving these goals. So next year, all the achievements will be documented and the report will be presented. And next key year is 2025, when all countries will have to present their reports on achieving the goals identified in the strategy on overcoming tuberculosis, and then the implementation of the action plan for combating tuberculosis in the respective region. So 2030 is the year of assessing achievement of the global development goals.
On the next slide, I would like to remind us once again that this intersectoral accountability mechanism has purposes: promoting the involvement of other sectors, healthcare sectors, and other stakeholders, partners, NGOs, civil society organizations, TB community, donors, technical partners, associations, everyone to participate in fighting tuberculosis in order to achieve our global goal. Now, next, strengthen the accountability of all the stakeholders. So, for that reason, that mechanism is called has four components that you can see here as a cycle: accountability, undertaken by countries on the global and regional levels. They must be implemented and brought to the national level as in the form of tasks and goals. And this accountability must be these responsibilities must be formed as strategic documents, not only in the healthcare sectors, but in other sectors as well. Next, monitoring and accountability. This is monitoring action that help fulfill the commitments. That's monitoring accountability and forming the next mechanisms. The next component, the assessment, is assessment of the highest level and sectoral level. We've also mentioned here, and Mr. Kuzin mentioned that this assessment is evaluating the results of monitoring, the accountability, and the implementations of commitments that were taken before, and gives recommendations on further improvement of anti-TB measures. This cycle is supposed to repeat many times. Next slide. In their turn, the European regional Council is providing help to all countries in adaptation and implementation of anti-TB measures. We help countries implement this mechanism. You can see there are 5 countries who are recipients of help. Ukraine is one of them. And we'd like to avail ourselves of the opportunity and say that Ukraine was one of the first countries that decided to do the initial evaluation that we'll discuss on the next slide, and one of the first countries to develop a roadmap and lessons learned. Based on that, we are drafting documents that will help other countries of our region to adapt the initiatives to their situations. The partners of the national, regional, and local level. If we're talking about a regional level, it's European Coalition on fighting tuberculosis that we cooperate with in 5 countries to adapt the mechanisms. A list of national partners, the healthcare sector, the civil society, and other sectors. Communities, parliamentary MPs, secretariats, technical agencies, donors, and the private sector. Next slide. We've also developed and recommended to the countries several stages of fine-tuning and implementation. You can see on this slide stages of adaptation for Ukraine. The first is the decision of the country to implement this mechanism, the mechanisms of cooperation and accountability. The next stage was organizing the initial assessment to find the gaps and further strengthening of intersectoral cooperation and accountability. And the next stage was agreeing on the roadmap and strengthening of international cooperation and accountability. After that, we will formalize this mechanism and implement the monitoring and evaluation of this mechanism in the country. One of the key stages on this road is, as I mentioned, initial assessment, initial evaluation. All right, so in order to run this initial assessment, we've created an instrument called the control list, the checklist. It has the primary document and 3 annexes, 3 addenda for checking on the on fighting the TB situation in Ukraine. How deeply is the government involved? How well is the civil society involved in solving this problem? And in performing the anti-TB measures, and on which stage the countries are currently. Ukraine is in cooperation with the WHO Bureau, the Council. You can see on the next slide the general summary and recommendations on the next slide. There are many of those recommendations. I tried to make it as concise and brief as possible. Next slide, please. On this slide, we can see the key, the summary, the general summary. Some of them are supposed to be introduced in the national legislation, and mostly the summary is regarding the intersectoral cooperation and accountability in the international dialogue, and fine-tuning the positions of all stakeholders inside the country, the high-level leaders and their participation the necessity of creating the roadmap that we'll discuss on the next slide, and the annual assessment, the high-level assessment, the progress report on fighting tuberculosis, and developing institutional and financial mechanism development. On the next three slides, I tried to give you specific recommendations and summaries. As we can see, there is a consensus of stakeholders concerning the leadership of the National Council on Fighting Tuberculosis and HIV, coordination of intersectoral action, uh, but we need a certain regulation to be drafted and expanding the functions of the National Council for such activity. And due to that, the assessment suggests that a coordination mechanism of intersectoral cooperation and accountability should be created in order to coordinate this cooperation and support the multi-sectoral cooperation and accountability on the regional and local levels, and in order to support organizationally the high-level monitoring. The next point of summary is that the current practices of intersectoral cooperation and accountability includes sustainable measures within the framework of this approach, especially during the transition period for funding and normative regulation. We recommend to ensure normative regulation on the practical level. That would be making a roadmap, drafting a roadmap, and making a plan of intersectoral cooperation and accountability system, and support that by the law of Ukraine on fighting tuberculosis. The next point of summary. Right now, we don't have a national research plan, and there is a need to draft such national common research plan and use those results for strategic decisions. The next point of summary is for and about vulnerable population groups, that is given by based on donor assistance and state regulation of the quality standards of medical services, and participation, sustainable participation of the government and the procurement mechanisms. There's a need to create a favorable legislation and funding in order to implement intersectoral cooperation, control of services quality, and ensure the activity of interdisciplinary teams. The next point of summary. In 2016 and 17, Ukraine has continued adapting the SDGs. It requires intersectoral cooperation. Intersectoral approach to accountability and reporting, because the national SDGs were defined in 2017 and the tuberculosis indicator does not take into account other indicators, fighting poverty, gender inequality, the unemployment problem, so on. So, the initial assessment recommends to strengthen the coordination of processes working on SDGs, to form the political will in this sphere on the highest level, and intersectoral cooperation in order to impact the social determinants of tuberculosis, to guarantee good nutrition and decent housing, the two I've mentioned, to set the clear mechanisms of assessing how well the SDG indicators are being reached. Next slide, please. Here, based on assessment results, to define national commitments, national partners. We have covered that a lot. I said I told you it would be a lot. It's difficult to fit it into one slide, as Mr. Kuzin said. So this is fine-tuning our measures with the SDGs. You will receive these slides as handout materials later. And the next step, the next slide, is finalizing and approval of the roadmap on intersectoral cooperation and accountability. We continue granting technical assistance, technical aid to Ukraine to finalize and approve the roadmap. And currently, we have this draft roadmap to define the goals and tasks. You can look up for the definition on this slide and also the structure. On the next slide.
So the structure of the roadmap consists of the analysis, assessment, conclusions, and recommendations based on the results of the analysis of assessment that consists of different elements of the multi-sectoral mechanism for multi-sectoral cooperation and accountability, the formalization mechanism, creation of a council, establishment of a coordinating body, a high review bodies, and other activities related to organization of multi-sectoral cooperation and accountability. That was my last slide, and I would like to thank our partners, two consultants in particular, Ms. Chorna and Ms. Zaika, and other national partners that helped us to adapt this mechanism for Ukraine, and huge regards and thank you for your attention. Thank you very much, Sayahat. Dear colleagues, if you have any questions to Ms. Sayahat, you're welcome. Maybe online? Nothing. Thank you very much. And we will continue with our agenda. We'll try to stick to our timelines. We have a small coffee break now, and we come back at 11:45 and continue with our presentations. Thank you very much. Don't go very far away from your computers, and please join us again at 11:45 for And I'm the expert of the Ministry of Healthcare of the Center of Public Health, and for over several years we've been dealing with drafting and supervising implementation of the state policy in the sphere of prevention, tuberculosis, HIV infection, virus hepatitis, and other socially relevant diseases. And we have a very important presentation now, because you know that we are in the process of a national decentralization reform process, and powers and authorities of local self-government bodies that are owners of healthcare facilities. Now local governments receive more and more powers and authorities, including powers and authorities in the sphere of healthcare, implementation of economic policy, which is a cross-cutting issue in the sphere of social policy, and overcoming tuberculosis. More and more role, bigger and bigger role is played by the communities, and the role of the state administrations is also increasing. So the departments on healthcare will be now part of the executive committees in local council. So those people who were affected by the problem of tuberculosis are also voters who elect members of local councils, and they control their activities in terms of development of respective healthcare policies. So it's a very important aspect of activities that makes the tool a wider one at a local level. And we would like to give floor for the presentation on the role of executive bodies and local self-government bodies in ensuring efficient national response for implementation of global commitments on elimination of tuberculosis. And it will be a presentation by Yana Terleeva, who is a deputy head of the unit of coordination of diagnosis and treatment programs. And this center on public health is one of the biggest players in our countries. And some colleagues of mine would say that that there are some issues and challenges in this sphere, but we can say that I am very happy with our 100% horizontal, efficient horizontal cooperation and coordination with this institution, which is a public health center. So Yana Terleeva, please, over to you. Can you share the screen with my presentation? So you can see that during this day we are emphasizing the issue that requires a really multi-sectoral approach, and everyone should understand their role and their place in the program of overcoming tuberculosis. And patient organizations, civil society organizations should be especially active, because they represent the interests of those people who were affected by this problem and play an important role in this process. If you remember, Saya Hart demonstrated a screen with all the partners who are involved in implementation of the development goals and implementation of the strategy, and I'm sure we would not be able to show all their logos in one slide. So for us, an important task was to demonstrate within these 15 minutes all the possibilities and everything that can be done by the ministry, the local self-government bodies, and civil society in order to control the situation with tuberculosis and achieve our common goal to eliminate tuberculosis in our country, despite all challenges such as COVID pandemic, development of resistant forms of tuberculosis, and reforms in this sphere. Still, we have our common goal, and since my childhood, I remember that the harder the tasks you identify for yourself, the harder you work to implement them. So I wish we all identify ambitious goals for our work, and I think that the state, in the conditions of such partnership relations, is able to achieve them. And if we look at the situation closer, we will understand that we have one thing in common for the majority of us. And this thing includes several areas of activities that requires multi-sectoral involvement for addressing our priorities for the national program of overcoming tuberculosis and for those who were affected by this problem. And you can see on the screen all the partnership and activity areas that we have. And one of the areas that were mentioned by the Deputy Minister and by the representative of WHO was elimination of legislative obstacles and discriminatory norms. And one of the important developments in this sphere for us is that we see now this political readiness, political willingness to amend tuberculosis legislation. But how many diseases are there which have a respective law? Yeah, but tuberculosis has a law that was adopted in 2012, which demonstrates a recognition of the importance of eliminating tuberculosis by the state, and the wording that was developed by the experts was submitted to the Ministry of Health of Ukraine, and it will be followed by the series of consultations in order to make this law more transparent, more efficient. And we call upon you not to look at it from a purely formalistical point of view, because each opinion should be examined in order to have the law that will really defend patients' rights and provide social guarantees to healthcare workers, that will enable us to involve social organizations, non-governmental sector in providing services to patients. So please follow us and all our updates, because we need very active advocacy support to make this law, the draft law, to make it a law. And we see support from the Ministry of Healthcare, from the national program, from the respective line committee on healthcare and subcommittee as well. We had Olga Stefanishin as one of the presenters today. So now we have this window of opportunities that it will give us a possibility to discuss changes at the high level.
The next direction also requires intersectoral approach, the risk factors of socio-economic determinants. Today, Ukraine is in the state of war and witnessing powerful migration processes inside the country. There are external migration processes that might also impact the policy inside the country. There are strata who are vulnerable, people who face poverty, and regulating tuberculosis situation by settling these social factors is becoming increasingly relevant. We've started the anti-smoking campaign and more, but it's not enough. And in order to understand that, we need to promote more proactively through the operational research and to prove by example of our country which risk factors, which external factors are the most relevant in case of tuberculosis, and work with them and assess them through the prism of operational research in order to step up to a new intersectoral level. The next coordinated group of measures is that we're not focusing on treatment only. An important component is shifting the attention to prevention. And the medical doctors and the medical service providers should provide more access to prevention and this pool of patients that the healthcare system should aim at is also not so easy to reach out to. So we are implementing, supported by donors, and a number of interesting projects supported by PAS, supported by Medical Alliance, who are also here. We can see wonderful initiatives of engaging social workers, additional assistance, and reaching out to patients who live remotely and are not so easily accessible to the medical services. We should build algorithms to receive government foundation funding and to fight the tuberculosis infection. We know that risk groups include not only medical doctors and service providers, but also social groups. We need social workers for that as well. The next group we'd like to focus our attention on and our partners' attention on is the implementation of psychosocial support of support service providers, so that this health scenario, is supported by these experts. It has proved to be effective. For example, projects supported by the grant of the Global Fund, by USAID, with the support of the Red Cross, Doctors Without Borders, and local initiatives. There are wonderful precedents. Let's think of Lviv, who allocated local budget resources to procure social services, but this is still very dependent on donors and local initiatives that are very dependent in their turn on the political will and the local situation. So now we're stepping up to a different level of settling this. Right now, the government is ready to listen and to take into account the financially well-organized projects that have proven their efficiency. One of the precedents is that next year there will be a 30 million hryvnias, 3 million euro procurement through the National Healthcare Service, supported by the Ministry of Healthcare. It's only 10% of what the local budgets are implementing nowadays. So we encourage to keep this issue in the focus of our attention and regulate legislatively the opportunity to work with the NGOs and others in the sphere of social support of the patients. Next is, let's remember, we live in the 21st century and the digitalization is happening. There's access to large chunks of data, and ordinary people who have found themselves in the situation of tuberculosis, and the first question you hear from them is, where would you find these folklore ways of the bear's fat or something. There's badgers and bears whose fat they're using as treatment. They can also have tuberculosis. So these things, these stereotypes, cause fear to voice their diagnosis, to come for treatment, and to admit that they have tuberculosis. So awareness raising for the population, for the general public, and for medical service providers, and for medical students at schools, at kindergartens, everywhere. Awareness raising matters everywhere, on every level, and the information should be presented in a correct manner. This is an important component of being victorious over this problem. For several years, we've been implementing the KSM strategy. It's close to finale. We need to analyze where we should step up, where should we strengthen our advocacy, social mobilization. So we invite you to join so that we work as a unified front to raise awareness among general public and risk groups. Initiatives related to tuberculosis are mostly chronologically within the month dedicated to fighting tuberculosis, but we need to keep talking about that throughout the year and engage schools, kindergartens, trade unions that can spread this information in a correct manner, and this is where we can be helpful. The next direction is that nowadays the stigma is running high, and with the National Healthcare Center, For the first time among European countries, we have run a research where we measured the stigma level. Can you imagine that 30% nowadays? So 30% of people who face discrimination, they're bullied, they are being put labels on. So it's really kind of popular to fight bullying now at schools nowadays. And how could we disregard the stigma that the TB patients are facing? We need to start with ourselves and then spread the correct knowledge, the correct data. So we are convinced that anti-stigma is an intersectoral issue. Many partners can join and contribute. Next, nowadays, although the countries procuring the treatment in a centralized manner, there are international donor support programs, but the reports from the patients show us that nowadays the patients face quite big expenses for an individual. People get tuberculosis, lose their job, don't get good nutrition, change their lifestyle to the worst, and if the person doesn't have that money, somebody could and should help. The local authorities, the communities that are capable of helping solve these problems. Let's imagine an average community might have 5, 10, 15, 20 TB patients, and I think that it's possible to prioritize tuberculosis treatment. I know you have other priorities, education, road building, and so on, but a healthy life is also for an individual is also a priority. Maybe the first thing that person needs right now is a truck full of wood for heating the house during this winter. Next, the people who faces tuberculosis, unfortunately, this story of combat against the disease does not end with the last pill taken by that person. Very often, people need restoration therapy after the official treatment is over. Quite often these people need to find a new job or retrain for a different job. And this person falls outside the attention of the healthcare system, but also need this additional social support and protection. We'd love to see the new law use the wide authorities of the local government to support such patients until they reintegrate into the society. We are convinced that we need to design regulatory acts that would help our legislation regulate the sphere and we consider it necessary to form this political stability with the focus of attention on tuberculosis and provide the necessary funding to the necessary allocations related specifically to tuberculosis. Because during the initial evaluation of the ministries and institutions, how ready they are to help combat tuberculosis, the response motivates us a lot and makes us optimistic. Nobody said, no, I won't participate, I won't contribute. The political will was there with everyone, but the next result of this initial assessment showed us that the ministries don't always understand what they can do specifically. Where should they jump into our initiatives? Where should they allocate the funding? Where should they, like say, the Ministry of Energy, how should they contribute? The Ministry of Infrastructure, what should they do related to tuberculosis? But this will be one of our tasks after the national dialogue to continue a series of more specific lines of cooperation with each of the stakeholders. So over 40% percent of ministries and institutions unfortunately don't have a clear understanding of what their role can be. But it's a question of time, I think. It's important to make this the issue of tuberculosis one of the priorities. Let's remember it's a UN General Assembly priority, the national strategy priority. Quite soon we'll have to report at the highest political level on what's going on here with tuberculosis, and everyone will be held responsible, not only the Ministry of Healthcare. And related activity of various sectors and the communities, we are convinced that tuberculosis will become history. Thank you very much. Thank you for your presentation, Jan. I think we can move over to the discussion panel and then answer the questions. I think we'll have those. Let me present the participants of the panel, but first let's answer the question of the Cherkasy region network. Ilya Zhakin, I can see he's in the room. And to add to what Mr. Igor mentioned, you will understand what I mean. He said that the primary level is not contributing to the support package of treatment that we introduced together with the Ministry of Healthcare in 2021, and 775 hryvnias per month for each patient. There's a lot of providers at the primary level already planned. This process is ongoing, but what I mean is everything depends on the executive level locally. In regions where the heads of pulmonological centers, after optimization, they only have one center in the region that is responsible for detection and diagnosis and treatment. So if there is a leader in the region and one institution is responsible for all processes, then the primary level cooperates, and we live up to the indicators, we fulfill them, and we control the post-treatment process, because people with tuberculosis know that this is a long process. That there can be throwbacks in the medical and economic sense. So I'm happy to invite to our discussion panel called Discussion Panel on Coordinating the Efforts of the Executive Bodies and Local Self-Government to provide effective national response to fulfill the global purposes on anti-tuberculosis. Ruslan Dechuk is a profiled state expert on anti-tuberculosis. Please take your seats, and we'll invite you to take the floor.
Ruslana is the person responsible for the area of tuberculosis and other socially relevant infections. And with Ruslana, we established very efficient horizontal cooperation connection. We do not exchange letters as an oversight institution, as a ministry, with the National Health Service of Ukraine. So we have good relations with Ruslana, with Ghana, with the previous management and the incumbent management of the service. So your area is extremely important, because the payment to a medical doctor determines a lot, if not everything. So the tariff and the quality of control of the quality of provided services plays a crucial role. Everything starts with financing and with control of efficiency. Our next participant I would like to introduce to you is Sergei Vasilyev, who is the director of the state-owned enterprise of the State Criminal Enforcement Service, because tuberculosis is closely related to functioning of the penitentiary system. First of all, the people who committed some crime and because of their economic situation, social problems, and tuberculosis is closely related to economic and social problems. And the second aspect is connected to the reform that's been implemented for the last couple of years. And all premises of penitentiary institutions are renovated and reconstructed. I'm not talking only about medical premises of penitentiary facilities. And Denise Maluska, our Minister of Justice, pays close attention to renovation of colonies and construction of new prisons and reconstruction of those who do not meet any standards, because those conditions of stay, of isolation, of quality of food determines the rate of treatment of tuberculosis and the number of those who were cured. And then we have a representative of the Ministry of Education and Science of Ukraine, Ms. Svetlana Fitsaeva. Ms. Svetlana also developed good cooperations with our ministry, and education is also very important in this sphere, because I will give you my personal example. As a child at school, I heard from my teacher of biology, who told me that tuberculosis bacteria can live in milk, and I was afraid to drink milk because I heard that in the 6th grade, and I knew that famous Ukrainian writers such as Lesa Ukrainka died of tuberculosis. Now we know that tuberculosis is curable, and we can use the antivirus therapy. So this is our next speaker, and I will give floor to Yana, who will introduce representatives of local governments to you. Yes, thank you very much, Pavlo. We've learned a lot about tuberculosis over the last several years, and I would like to invite Tatiana Bondarenko, Deputy Director of the Department of Healthcare and Rehabilitation of Vinnytsia Oblast State Administration. Today, Vinnytsia is one of the leaders demonstrating the political will to overcome tuberculosis and demonstrating their capacity to make revolutionary changes in the existing conditions. So during this session, we would like to hear about your experience and views on the possibility to overcome tuberculosis. Then we also have online participants of our panel discussions representing municipalities. Mr. Vitaly Bereza, who is the head of Onufrievska Village Council, and Lilia Gerasimchuk, who is the head of the Social Protection and Healthcare Department of Ajamska Village, Ajamska Local Council of the Territorial Community. Both communities are ready to share their experience and visions of their capacity to overcome tuberculosis and what they are doing today and what they would like to encourage other participants to do. So I think I've introduced all the key speakers, and we also have a representative of the Ministry of Health of Ukraine, who is the heart and the coordinator of the entire process, Pavlo Palamarchuk, who does a lot and is personally committed to utilize the ministry's capacity, because we can see that all our solutions offered by the Public Health Center are actively promoted by the ministry, and a lot of orders were issued this year, and we've reached a new level, and we are very grateful to the line departments for their active position. And we would like to start our session and announce it open. Pavlo, can you present the first participant? I think we will start with the issue of payment for services. We have two packages, and I think Ruslana can tell you more about it. But we started this reform 2 years ago, and I think we had a good system in place, because in the past there was no oversight of the efficiency, and now the ministry implements several criteria for controlling the quality of work and heads of medical facilities. So several bylaws were developed that regulate how the work of the head of the facility will be paid in case of increased number of people who were cured and recovered. So I think a lot depends on the tariff and the focus on the patient, because the patient should always be in the center of attention. The state pays huge monies, and tariff will be increased even further next year, but still we have to control the quality of provision of healthcare services. A lot has been done so far, so I would now like to give floor to Ruslana, and we would like to hear from you, Ruslana, about your cooperation with the local authorities. Yes, the Pavlo asks quite difficult questions, and we would like to invite a representative of the leader of the regional level, Natalia Frankina. She joins us, and she is the director of Dnipropetrovsk Oblast Outpatient Medical Facility of Dnipropetrovsk Oblast Council. So from you, we would like to hear about a more comprehensive approach to establishing cooperation and the focus on the recipients of the packages that were developed in order to improve the services provided in this sphere. So Ruslana, first you. Thank you, Yana. Thank you, Pavlo. And first of all, I would like to mention that National Health Service of Ukraine is the only coordinator of providers of medical services, and there is a special program that was developed and outlined the scope of medical services that needs to be provided to all the patients who need them, and important documents for providers of medical services if, it, includes specification and conditions for procurement of medical services, the procedure for provision of medical services, and tariffs for provision of services to patients approved by the Cabinet of Ministers resolution. As to the accessibility of medical services, this year we ensured that every patient receives timely and high quality medical assistance. To this end, we involved the Ministry of Health and the Center of Public Health. We developed a package of services to be provided to patients and children with tuberculosis. And when we talk about provision of medical assistance, I should pay attention to the fact that the primary role here is played by the primary healthcare level, and treatment and identification of patients with tuberculosis was included, and their referral to respective service providers. That's also envisaged in the order number 524. And at the same time, the package of ambulatory medical services identifies the number of specialists that are mandatory for referral, such as physiatric specialists. When we're talking about outpatient and inpatient treatment of patients with tuberculosis, we enabled them to the patients to come to doctors independently without being referred by the primary doctor. As to the tariffs, we established the scope of above 40,000 patients, and signed agreements with 125 facilities, and provided for establishment of one regional center per oblast. And when we talk about the route of a patient, we should say that the patient can receive treatment in outpatient and in inpatient facilities. If a patient does not require inpatient or hospitalization, he can receive outpatient treatment in one of the facilities, providing diagnosis and treatment for patients with tuberculosis, or they can go to their family doctors for respective facilities, provided the respective healthcare or medical facility signed a respective agreement at the level of for providing primary assistance. We signed such agreements with 254 facilities, including 5 private facilities and 5 privately practicing doctors, and we allocated more than 5 million hryvnias per package. And these packages are paid separately, so this is a separate package separated from the primary assistance, and 25,000 hryvnias were allocated per patient, and it also envisages adjustment of the coefficient depending on the type of treatment that is provided. So it's basically what I was going to say about accessibility and medical guarantees that were provided to patients in terms of diagnosing and treating such diseases as tuberculosis and others. And I would like to use this opportunity to thank all our experts from Ministry of Healthcare, the Center of Public Care Health, for their huge support in developing requirements for 2022 that were approved by the Ministry of Healthcare. And we are very grateful to civil society organizations and heads of anti-tuberculosis facilities and primary medical service providers for their contribution to development of the package of services for 2022. The requirements were approved by the Ministry of Healthcare, and I would also like to repeat what Natalia said, that we have a lot of big progress in cooperation with civil society organizations, because we can overcome tuberculosis only if we work together. And thanks to this cooperation, we will be able to implement the plan developed by the state, and we have really are working on identifying the instances of discrimination and stigmatization of people with this disease, which is very important in my opinion. So that's all from my side.
Thank you, Ruslana. I'd like to give the floor to our online participant, Svetlana Fitsaila, our colleague from the Ministry of Education and Science. Happy to see and hear you. Good afternoon on behalf of everyone. Good afternoon, dear colleagues. Thanks for inviting me at the second National Anti-TB Dialogue. I'd like to share with you our success in intersectoral cooperation and with our vision, what our ministry contributes to fighting TB. Within the concept of the new Ukrainian school, one of the key topics of education is motivating children to healthy lifestyle, awareness about health of themselves and the others in the community, in public places, in order to keep their health intact. And anti-TB is implemented in our system of education as prevention awareness, and it's included in disciplines like basics of healthcare and the biology curriculum. In the standard curriculum of high school, it will also include a discipline called welfare, well-being, and healthcare. When we include prevention discipline into our educational program, it's very important to stay in contact with the NGOs, medical experts, with the law enforcement agencies, with social workers. And this year, we have a success case for cooperation the PAS International Organization, and the Ukrainian Education Improvement Institute, which is under our ministry, have drafted methodological recommendations for educators at high schools and kindergartens, where they have covered pedagogical and medical aspects of TB. Nowadays, these materials are being approved by the expert community at the ministry, and these materials are interesting because they are a complete manual to help the teachers organize classes on this topic, and also this manual contains pedagogical tips on teaching these topics in class. Such intersectoral cooperation here is important because, unfortunately, teachers locally lack tools and manuals to help them teach relevant modern information about TB, bust the myths from our information environment, to form correct knowledge about tuberculosis for the children and a healthy attitude to this disease. An example of these methodological tips, this manual, is fulfilling all these tasks, and hopefully it will be a good support and a helping tool for teachers to help raise awareness about TB prevention. And it's also important because this information will be distributed also through children to their parents. So it will promote distributing correct information among wide public. Thank you for your attention. Thank you, Svetlana. Any questions? All right. I'd like to add to what Ms. Svetlana mentioned. Ms. Svetlana gave a lot of detail about creating a positive attention, proactive attitude to tuberculosis problem among wide Ukrainian public, because there are a lot of myths circulating, closure of tuberculosis clinics and whether tuberculosis can be treated at home. So with the Ministry of Education and Science, children who are in inpatient clinics, there are not many, but they should have high-quality education services, and I'd like to congratulate this profile ministry that, by decree of the Cabinet of Ministers, they've approved the project called the School of Superheroes, and from the next year, the children who are in inpatient treatment or in amalgamated treatment, the children who need a long time, like 4-month long treatment, 6-month long treatment, or even more, to keep them in the educational system. There are regional leaders in this sphere. Another problematic topic is patients who are serving in penitentiaries, and there's a high-quality conceptual reform that is changing the conditions for the better, so that people after penitentiary actually become better as social elements, get re-socialized. And I'm happy to give the floor to Sergei Vasilyev, head of the State Penitentiary Service. And we've been working with him on a high-quality level to integrate our two systems in the tuberculosis fighting sphere. Thank you. Thank you for the attention to the medical services, to the penitentiary held citizens within our penitentiary institution of Ukraine. The Ministry of Justice and the healthcare center are joining the global initiatives and the commitments of Ukraine to put an end to tuberculosis in Ukraine, including penitentiary facilities. It's not a secret that in our facilities, um, the citizens that are held there are, let's call it, marginalized, and the morbidity is 27 times higher for tuberculosis than average in Ukraine. We can keep speculating on why and how that happens, but we understand what type of social group that is, what is their attention level towards their own health. So we understand what type of people we're talking about. So let's stay unbiased and just discuss that Ukraine has undertaken obligations and commitments to implement this mechanism. The Ministry of Justice plays the key role in monitoring the violation of TB patients in penitentiaries, and it's their responsibility to maintain the cooperation between the Ministry of Healthcare and the penitentiary facilities. When people find them get into penitentiary facilities, sometimes they have limited access to diagnosis and prevention and the application of effective treatment schemes and fighting the secondary reactions, the side effects. This is due to the fact that the law of pre-detention and about the detainees, the people who are held in the penitentiary facilities. The decree of the Cabinet of Ministers 205 about medical services to the inmates must be sent to the regionals of physiopulmonological centers, and they have the right to medical services up to the moment that they are not having tuberculosis again. And it should be based on the material technical base that is available to us nowadays. Concerning the inmates, these patients get to the TB dispensaries based on our penitentiary service of Ukraine. There are 6 medical facilities like this nowadays. This is related, first of all, to the conditions of detention and of infection control, and the decision of the 5th, dated December 5th. We have stopped the anti-tuberculosis clinic number 61, and it is now functioning as the regional laboratory of level 3 for TB diagnosis. So all confirmed cases are sent to our anti-tuberculosis facilities. That's about the relevance of the issue. Concerning the contribution of the Ministry of Justice to the system of intersectoral cooperation and accountability to fight TB, the Ministry is contributing quite proactively to the system, and it can also join by delegating a representative of the minister to the National Anti-TB Council to reassess the legislative base of Ukraine, to make amendments to the process of helping the TB patients who are inmates based on the decrees dated 2014, to help in the the penitentiary system of Ukraine by the digital X-ray machines, gene expert systems, LAM tests, and other modern equipment. We are cooperating with the Global Fund current project to provide this up-to-date equipment, and we are also receiving assistance on in basic In basic medical equipment, we are expecting the arrival of 4 gene experts, and we have 40 of them, and 4 are pending. So we are doing diagnosis at the entry gate for all inmates that are suspected to have TB. Elimination of the current barriers for social workers and NGOs to penitentiary facilities, and promoting treatment and diagnostical measures at penitentiary facilities. That's also following the Global Foundation plan. We have agreements and memoranda at the Ministry of Healthcare level and with the PHC. On the regional levels, we have representatives of NGOs who are assisting us in the framework of their project activity, supporting the visit of human rights activists to penitentiaries, where they give legal consultations to the inmates, support of inmates with TB diagnosis in order to form and support and promote treatment of tuberculosis, promotion of a medical referential system to integrate the entire medical services system to the TB patients, and providing them with anti-tuberculosis treatment. We are now running the system of anti-HIV and integrating it with the TB patients registry, and our responsible workers are entering that information about them. And the Ministry of Justice have funded, and the Ministry of Healthcare have procured equipment for the unified digital healthcare list, the system. So we are now testing this program to provide as soon as possible the digital referral of our patients and correct identification of the patients, and sending their forms to the medical institutions of Ukraine. The key problems we are facing right now and the National Healthcare Service needs to pay attention to is that the inmates who need additional medical sensibility tests, we have no such specific package of medical services, and the PHS has no chance to test efficiently and monitor the efficiency of treatment. This is a small part of the package that is existent in the NHS system to help the patients. So payment for the medical help for TB patient, but this medical element is still not solved fully, and we can't always provide the just access to these services as compared to those who are in freedom.
And we have another problem, which is related to the fact that the health care center implemented an order on the use of anti-tuberculosis medications. So since 2020, we've been using modern, efficient medications that were approved by the commission, approved by the Physiopulmonological Center and the Public Health Center and other relevant institutions. So they've developed an exhaustive list of medications that can be applied, but the only problem that we have here is the lack of regulation of the procurement process for pazimine in adult dosages, and we receive it from the Committee of Lung Specialists. And our participation in the implementation of the mechanism of multi-sectoral cooperation and accountability will increase our capacity to protect the rights of people who need that protection. So thank you very much, Sergey, for your presentation, because of treatment and better socialization of people in the penitentiary institutions is extremely important and one of the components of the process of combating tuberculosis in Ukraine. We have in the south of Ukraine 2 colonies in Kherson and colony number 7 that were renovated, and the new healthcare facilities, premises were provided so the patients will receive decent treatment and better epidemiological surveillance procedures are in place as well. Now I would like Yana to introduce other participants of our discussion. So we started this panel a little bit later and we are already late with finishing it, but I would like to ask our timekeepers to be strict in finishing our panels. Thank you, Pavlo. I would like to remind our participants that you have only 5 minutes for a presentation. Yes, but it's really useful to hear from you because it gives you a possibility to talk to people who are sometimes poorly reachable. But now let us come back to the role of the departments in the system of healthcare because reforms are upcoming and the Center of Public Health refers the achievements that we have in this sphere and the challenges that we face today. And we would like to hear about that from Tatiana, about your view and opinion about the available tools and your current capacity and what you lack in order to be efficient in this sphere. Thank you. The goal that was presented today and concerning overcoming tuberculosis by 2030 is quite ambitious, but we realize very well that we have to do a lot in order to achieve it and make very powerful, serious steps towards it. And I would like to say that the administrative reform and decentralization brought a lot of positive things with them, but at the same time, there are a lot of challenges for the system of healthcare and for coordination of its work in the regions. In our region, we made some steps. We've implemented some measures in order to reach the current state of affairs, and we understood that without an ongoing efficient dialogue with the communities, with heads of those communities, owners of healthcare facilities at the primary and secondary level and tertiary level to a certain extent. Without that cooperation, we would never be able to achieve positive results. And I would like to give you an example. In order to increase efficiency of prevention and treatment of tuberculosis, positive achievements are not possible without active implementation of provision of anti-tuberculosis assistance at all levels, and that is not possible without understanding by heads of local communities and local self-government bodies. It's not possible without their understanding of the need for the steps they have to do to make. When we created our Caesar Pulmonological Center, we reorganized 5 anti-tuberculosis facilities that were located in different local communities of our oblast. And in order to be efficient in these activities, we carried out negotiations and meetings for several months. We started with the members of a local council and ended up with all local communities and respective local councils. I would like to say in the very beginning that we've initiated regular weekly meetings that are now held online with all heads of local communities. That was initiated by State Oblast Administration, and the meetings are presided over by the head or the chair of the local state administration or deputy head of the Oblast State Administration. And they are not only talking about new normative and legal documents, but they also have a question and answer center's part, and it's ongoing dialogue because the heads of local communities have to understand what they need to do and how they can receive money for provision of specific services and which services will not be paid and what they need to do in order in each ambulance station and which center for provision of medical and sanitary assistance, what they need to do in order to receive money. And in October and November, we had regular meetings to discuss these package developed by the National Health Service and supplementary packages. And for local communities, it was a surprise. The heads of local communities were surprised to hear that these general primary services packages, they were surprised to hear that it was their obligation to ensure provision of anti-tuberculosis assistance in their healthcare facilities. So they did not expect that. They tried to push these functions to other facilities funded from other budgets. And when you have this ongoing dialogue with representatives of local communities, they ask you questions as non-medical specialists, and they want to hear professional but understandable responses or answers from us, and that's why we keep our doors open in the healthcare department. We're always open for representatives of local communities, and every week we are visited by heads of communities together with chief doctors for a joint discussion of these important issues that need to be implemented to achieve the objectives identified for local communities and for healthcare facilities. And intersectoral cooperation is extremely important, and we felt that when these reform processes started in the sphere of work of social services, yes, that involved centers for provision of social services, services for children affairs, and again, healthcare sector initiated providing these explanations in local communities about the work of social workers in the communities. And we have these focal points, these interlocutors with whom we can establish our intersectoral cooperation. Yes, thank you very much. We can see that Vinnytsia is really a leader in this process, and an important aspect here is that this intersectoral approach is important not only at the national level, but it should be cross-cutting at the regional and local level. And we can see that at least in Vinnytsia, life does not end with vaccination and fighting coronavirus infections. So everyday life and work of healthcare department includes paying attention to tuberculosis as well. And now, everything that's been discussing so far at the national level, let us look at how available it is at the local level. And I give floor to Natalia, who represents one of the regions with the highest burden of tuberculosis, HIV infection, and hepatitis. And this region, at the same time, is one of the leaders in transforming the system that was inherited by Natalia. But we can see quite a rapid movement toward achieving the objectives and reaching this organizational model and providing human potential. So could you share with us what was successful and which challenges you faced, and whether you were successful in receiving this multi-sectoral support, and what can be done here to improve it? Thank you, Jana. I would like, can you show my presentation on the screen? Okay. I would like to remind the participants about the contribution of executive bodies in this process, and I would like to focus your attention on the fact that Dnipropetrovsk region was making huge steps, and we did the following. First of all, we reminded our Oblast State administration that combating tuberculosis epidemic and hepatitis, it needs to be addressed from the regional level, and they had to provide the material and technical support and financing for payment of all municipal bills, not only in anti-tuberculosis facilities, but general healthcare facilities as well. And that was their obligation, the regional government obligation. Then distribution of information, and this information policy became our slogan for 2021. And then they were also responsible for organizing supervision of work of all anti-tuberculosis facilities that should not be only done by regional physiopulmonological center, but also by the owner of this center, which is our Oblast Council and Oblast State Administration. And of course, the focus of 2021 in our region was on social protection of people with patients with tuberculosis. First of all, children. And today we already mentioned this school of superheroes, and I will demonstrate what was done here a little bit later. I will not mention all the documents. They all cover the period ending 2023, and now this period is extended to 2030. And we hope that by 2030 we will overcome tuberculosis in the region, and not only, but in Ukraine as well, because that's our commitment to the UN, and we have no other way than to move toward overcoming tuberculosis, even in the conditions of COVID-19 pandemic, because we know that all physiopulmonological centers today perform this additional function as well, which is a provision of treatment to people infected with COVID-19, because Odessa, Lviv, and Dnipro are among the leaders of COVID infection. So our contribution in 2021 that we were able to communicate with Oblast State Council, Oblast Council, and more than 278 million were spent on physiopulmonological center after this March amalgamation of all facilities into one center. Within the framework of regional investment projects, that means that members of parliament, members of Oblast Council, members of local councils provided funds, and there were also funds added by amalgamated territorial communities for development programs. So what they contributed a little bit more than 7 million hryvnias in 2021 alone.
We're proud of that, because our physiopulmonological center has never known such an influx of money for the events that have allowed us to get contracted for 14 packages. Right here you can see pictures of my personal pride, the School of Superheroes that we launched with Natalia Mosychuk. This is the largest superhero school in Ukraine. 2 kindergarten and 2 for school children. There's a computer tomographer that we are launching in December, a PCR modern laboratory that we've launched in November, and we're starting to test it quite proactively. Like, we covered half of the region. This sanitary vehicles for mobile brigades, for mobile palliative assistance, and much, much more. Regional COVID and anti-tuberculosis treatment is also on our platform, and we're covering this diligently. We're carrying this cross, but we know this is something that must be done today. Within the framework of informational support under personal aegis of the regional head council and the Permanent Commission. From November 2020, we've had a lot of social activities. The largest ones were 35 mobile medical towns, the fluorographic equipment, diagnostics of tuberculosis, HIV, and other infections. That's a complete coverage of 5 amalgamated communities. We've signed cooperation memoranda and monitored, tested all citizens of those communities. So we know there's demand. We will continue this work in 2022 and 23. And we do understand that nowadays we have this experience of work in the penitentiary facility number 70 in Kryvyi Rih, testing all inmates without exception, using our mobile fluorography equipment and pulmonological assistance. So I think that it depends not only on the head of the regional physiopulmonological center, all of that depends on the complex teamwork in the region. And if the region has an understanding of and communication with the administration, with the department, with the regional council, with the administration, I don't think there will be obstacles as such. You will always face understanding. So we're ready to share our experience, accept the foremost regions like Vinnytsia, Lviv, Odessa, and I wish fruitful work for all of you. Thank you. We at the National Program take pride in our regional physiopulmonological services, and we are grateful to Natalia for continuing to change the image of anti-tuberculosis service as a modern, creative, and powerful. And now we are moving over to we've mentioned various regions several times, and we're changing accents and analyzing the amalgamated communities. We've worked with Level 2, the Secretariat of the National Council, and all partners that work in the anti-TB sphere. But let's listen to examples that we have nowadays. Please, Ms. Lilia Gerasimchuk, Head of Social Support from a Jamska amalgamated community. As of today, how much can amalgamated communities prioritize the medical sphere? Is there a chance to fight tuberculosis? What barriers do you face? What assistance do you need to have more chances to fight tuberculosis? Hopefully, Ms. Lilia is joining us online. She is not, apparently. Dear Lilia, our organizers are telling me they can see you, but they can't hear you. Please switch on your microphone. Unmute yourself. See, that's the downside of hybrid events. Okay, then maybe Vitaly, who also represents Onufriivska Village Council, head of the council, maybe he'll present his experience, share what they're doing. Kirovograd region is a region with interesting pool of experience aggregating all councils under the aegis of the regional state administration. Last time the deputy minister and the MPs visited there, The heads of the amalgamated communities also participated at the session of regional coordination councils to participate directly to solving today's issues at regions. Mr. Vitali, happy to see you. The floor is yours. Tell us what it's like. Good afternoon. Kirovograd region and our community is happy to greet you. We have been an amalgamated community for 1 year only, but we're still one of the leaders in vaccination. We have something to be proud of. Our problems are related to organizing the medical sphere's functioning on our territory. What we try to do is react as effectively as possible. Of course, the problem of a medical sphere in decentralization is present, so we participate in all available events that that are relevant to us. And our task is to improve our functioning in this sphere, support the medical institutions that function here, provide psychosocial support for TB patients in our territory. What does this medical institution support stand for? Procurement of equipment and of medical materials in order to diagnose and to perform treatment, procurement of medicine or allocation of funding for symptomatic or pathogenic therapy, also procurement of tuberculin for the funds of the community in order to diagnosis the children and the risk groups. On December 3rd, Kropivnitsky organized events on tuberculosis, where they voiced the problems of the physiatric service in the Kirovograd region. The head of the Center of Primary Medical Sanitary Assistances been a great help to us and with great understanding. We have a good connection, so we have results in the sphere of development of the primary level in the situations of quick change to the medical sphere. The primary level is doing prevention and timely diagnosis of the disease and performs control over treatment of such patients. So we plan to contract a services package for 2023 on treatment of the primary level of tuberculosis. We have 2 doctors here who've been trained, and the primary level has all conditions for the contract. And we don't plan to stop here. We are looking for more opportunities to train other doctors, compensating their costs for that training. Social support of the patients, I can say this. In order to promote long-term treatment, we plan to give the patients the psychosocial support and giving them the nutritional packages. From January this year, we've organized the work of the Onufrievsky Center of the Red Cross in Ukraine, and the volunteers are also going to join the social activities. The nutritional packs will be bought by the money of local budgets and the socially responsible business too. Basically, that's it. Thank you for your attention. Thank you, Mr. Vitali. Quite an interesting precedent of complex and systemic approach from the regional territorial community. Hopefully we'll have more interesting examples that will search for with partners and present at other platforms. And basically we have discussed the multi-aspected vision of combating tuberculosis. Hopefully you found this useful. We do understand that this is a stimulus for further activities, including various participants of anti-TB program. Pavlo, the floor is yours. Please close the session. Yes, very briefly. I know I must give the floor to present our international panel speakers. We'll have an hour and a half after lunch for a dialogue, proposals, and so on. I'd like to tell you that all of our results and our strategic plans would be impossible without international support. The expert support, financial, from the Global Fund, from WHO and others. So I'm giving the floor to the head of the profile department of our chief institutions of our state policy in this sphere, Olga Gvozdetska, and she'll present other panelists. Thank you. Thank you, Pavlo, for this presenting. I bring my co-facilitator, Ms. Elena Michozina, here. Jana mentioned that blitz performances must be swift, but we are in a speed of sound vehicle. So the previous speakers have robbed us of our time a little bit, let's be honest, so we will keep everything as brief as possible. Please concentrate. So before giving the floor to our partners, our international speakers, I'll tell that a lot has been done. And we do realize that without international expert and financial support and without the best practices, it would have been impossible. So we will have 4 speakers today who will be speaking as fast as possible to meet our schedule. Georgy Dimov, the national TB expert. And Zoya Pogorila, national coordinator of HIV, AIDS, Tuberculosis of the Red Cross of Ukraine, member of the National Council on HIV/AIDS, and also we'll have speaking Larissa Mori, Deputy Director of a USAID Program Department, and Luci Cadizio, Executive Director of Stop TB Partnership. Will only be here with Yelena physically. Our other partners will be speaking online. Now the floor goes to Luci Cadizio. She has quite a minute to speak. Lucica, please.
Hi, hello. Good afternoon. Good morning. Good evening. Good to see you all. Dobro den. Dobro večer. Dobro utro. I'm trying different type of words that I think will make sense, but actually, I know you have translation, and I just want to say, first of all, thank you very much. Thank you very much, not for inviting me here. I want to thank you for that, but for the hard work that you are all doing. And I actually was online for a bit more than 1 hour, and how to say, you feel a bit warm, a lot of warmth, and a bit humbled when you hear the very high level discussions that you are having. You know, the work that is happening, and you know how amazing you are all, not only in fighting TB, but also showing so much resilience to COVID. Continuing with your fight, with your work, with your lives, and with your families. I understand that I don't need to stop for interpretation because it's already happening, right?
Yes, correct. It's simultaneous.
I will just go ahead by saying that it's a very good moment in Ukraine to have this kind of conversations. For us, as you know, for us in Stop TB Partnership, my name is Luci Cadizio. Let's do this in case there are colleagues, of course, that will not know me. I am Luci Cadizio. I am a medical doctor from Romania, and I had the Stop TB Partnership that Geneva, located in Geneva. For a long time, we continue, and we will remain a big supporter of the Ukraine government, minister, and especially national TB program, including and putting at the forefront the great networks of civil society and survivors that you have in Ukraine that are fighting TB, but also HIV and other diseases. It's a very amazing environment that I consider in Ukraine very specific, for sure unique in Europe, in which you manage, it's not easy, I imagine, but to stay at the same table and to discuss government, politicians such as parliamentarians, civil society and survivors, technical people and celebrities in trying to push forward the agenda for Ukraine. The meeting today is looking at the multi-sectoral cooperation and collaboration. And I just want to say three things. The first is that, you see, during the UN high-level meeting on TB, we all pushed very hard for having a system for accountability. When it is to implement it, it's a long discussion and not easy. And I know that the document that you have is really good. I didn't read it because I would lie. I don't know the language, but my colleagues helped. It will need, you know, as you all know and outlined, some further developments related to the priority areas and key interventions and barriers and links to other issues, including health reforms and universal health coverage. But it's a fantastic tool that you have. But what I wanted to say is that we, for a long time, speak about accountability. When it is to keep someone accountable, it's not just in TB, it's not in Ukraine, it's everywhere and in any topic. If you want to really see who exactly invests and is interested to change something, whatever, you just say, do you agree that I held you accountable if you deliver on this or not? It doesn't need to be at work. I tell you, you can do it even with your friends. If you plan a party and you have several people coming in to help, the moment you say, if you fail bringing the drinks, I will hold you accountable, you will see that people are already somehow pushing back. So it will not be easy to really hold accountable everyone that is responsible for this, but I think the conversation must start, and I have to tell you that Ukraine is very advanced in this discussion, in putting the people affected by TB at the center and trying to see what are their needs and what are the barriers that they face in addressing, in accessing services for TB or other services. I know you are in the health sector reform ongoing. I know that there are discussions on universal health coverage there. And I know that it's not easy to include TB there. You know, it's the right of every single person to health, and it's not a luxury to reinforce that for every single person, irrespective where it comes from and background and color and religion and other parameters, should have access to services, should have access to diagnosis. The latest recommended tool should have access to treatment, should have access to preventive treatment. This should be a given. It's not possible to think of ending TB without ensuring this. But it's also not easy to do it. You see, for a long time, some of us are here in TB for most of our professional life. And some of us are approaching, ages that, we feel like we might need to change or we might even retire. And for a long time, we fight to end TB. And we are doing a little effort, we go a bit forward, and then there is something either making us stop or even push back, like now with COVID. So it's very difficult to discuss accountability unless everyone involved is around the table, and then unless we speak about, we need to ensure for our people with TB the best comprehensive package of care. We need to have the funding for that, and we need to have the tools to do that. It's very easy for me to say that from Geneva. I know some of you, or most of you, or all of you are bitterly smiling, because what is always missing are the money. And I'm not saying that money will come easy, but unless we are very much in the face of people, in the face of Ministry of Finance, in the face of funders, in the face of development banks, requesting funds to cover everyone with this comprehensive package, nobody will come to say, oh, I think in TB you guys need to do something for preventive therapy because you didn't do it in household contacts. You need to scale up that. so you didn't include it, so I'm here to bring you that. Nobody will do that. So we have to have it already into our plans. And we need to have, together with these comprehensive packages of care, we really need to think, and I know you have that in mind, of what are the tools and what are the things that we need to really ensure the political commitment and ensure that there is a mobilization of the authorities and the society. Because we never had money enough in TB, we very often neglected this part. It was, advocacy, ensuring political support, proper communication into the society were always left behind. Now we pay the price, not for TB, but with COVID, the fact that education for health was so much neglected. You see, last year, we were telling people how to wash hands. I mean, like, what? In the year 2020, we were explaining how you wash hands thoroughly, how you cough. It's really a humanity failure. TB, as COVID, is an airborne disease. And we know that there is a lot of visibility for COVID now. There is a lot of visibility for health in general. There is a lot of visibility for pandemic and preparedness response. TB is also airborne, goes through nose, ends up in the lungs. Our colleagues, yourselves, from all around the world, moved from taking care of TB to taking care of COVID. Can we do something? And we know what we do, and we discussed about it, and actually you started doing very well to address TB as good as it is into the COVID. Not only in Ukraine, but all over the world during COVID, TB case detection and diagnosis dropped. Treatment results are not great, and the rights of people and the stigma and discrimination actually increased. If we want to be successful, we should be able to address this together. And we should think in a smart way, bringing whatever tools we have, digital technology, artificial intelligence, mobile X-ray. These days, this is one of my most, for me, is a surprise. These days, you have a mobile X-ray. Is this size. You can use it to even make a selfie. It's you can take it in a backpack, and together in the same backpack, you can also have a diagnosis tool for molecular diagnosis, the one that is developed by that Indian group. And you can go actually door to door and do screening. And when you do an X-ray to a person, you don't find just TB. Actually, you will find many, many other things. Maybe you will find TB the least, but you will find cancer. You can find asthma. You can find God knows what pneumonias and pleuresia and so on. So what I'm trying to say here is that discussing the accountability and multi-sectoral cooperation is a fantastic opportunity to bring up things that can be done in a different way and to bring all the stakeholders around the table. We know that tomorrow is the International Human Rights Day, and conversations about the rights of people, the stigma, discrimination, and inclusion are never easy. But without eliminating the legal and other type of gender and discrimination barriers to ensuring equal access to care, it will not really work. It's not going to happen overnight. It will request a lot of work. But conversations are meaning a lot, because then people start to really understand what is going on. I took a lot of time of yours, and I didn't say anything you didn't know. We are and will remain with you, as you know, as the Stop TB Partnership. We support Ukraine in different ways. With the Stop TB Partnership Ukraine, our continuous work with Yana and the colleagues from the NTP and the colleagues from the government. We met with His Excellency, the Deputy Minister of Health, a few days ago in Geneva. We will remain together in the support from GDF. We are also, as you know, helping with the implementation of the Global Fund grant, whatever. And Ukraine is the only country that we really want to focus on the famous strategic initiatives that is looking at finding missing people and TB. There are many other things that we do, but and we have a very vibrant civil society and community network that we always reach to Andrei and his team, to Olia, I forget names, I always know that I will not mention everyone, but we always have such a great collaboration and understanding in supporting each other shoulder to shoulder. 2021 is coming to an end and was an ugly year. 2022 might not be fantastic, but let's hope that it will be better. And with this meeting that you have here, I'm really impressed because we don't have this type of meetings in other countries, and we have to work to make Ukraine an example in the region and in the world. I thank you very much.
Дякую, thank you, Lucia, for your speech and such impressive personally for me. Ну, насправді, мені для мене дуже такі
Yes, that was a very inspiring presentation for me because, this partnership, we've been in this sphere for a very long time. And for me, it was a revelation, for instance, that based on the results of the research, that we still have this high index of stigmatization of people with tuberculosis. So we still have a lot to do here and to join our effort. And I think that the third national dialogue will have more presentations about positive achievements and progress. So let's continue working together because we have this open partnership which is well established, and we are doing our best to be accountable and as open for cooperation as possible with governmental and non-governmental organizations. So I think after 1 year, we'll have some success stories that we can be proud of. And our next speaker is Larissa Mori, Deputy Director of Healthcare Programs of USAID. This is an organization that does a lot in terms of financing and expert contribution in the system of development of civil society and governmental institutions in Ukraine in order to prevent not only tuberculosis pandemic but HIV/AIDS. But unfortunately, I have to leave you here. Larissa, I will be listening to your presentation online because I have to leave you and travel now. Olena will be here. I leave the elevator now, but Olena will stay with our speaker.
гарного заключення тоді форуму.
I will try to make this as short as I can. But first, I'd like to thank everyone who's participating today. You know, the importance of dialogue cannot be underscored. You know, bringing everyone together and giving everyone the opportunity to discuss is you know, incredible and something that we should all be striving to do on a very regular basis. Fighting tuberculosis, it remains a top priority for the United States government. At the September 2018 UN General Assembly high-level meeting on TB, where the heads of state committed to ambitious targets, USAID also launched an initiative called the USAID Global Accelerator to end TB. And this initiative increases commitment from and builds the capacity of governments, civil society, and the private sector to accelerate national progress in reaching the global targets. Our accelerator focuses on countries with high burdens of TB, where USAID can align with local communities and partners to deliver performance-based results. Our accelerator recognizes that USAID's investments are most successful when they're matched with strong partner government commitments. So what does this mean for USAID's work in Ukraine? Well, to increase political commitment and better align our investments with national priorities, we've developed and signed a memorandum with the Ministry of Health that clarifies areas and ways of working together to achieve TB targets. We also develop an annual TB roadmap that guides our activities. And in order to ensure that our roadmap is comprehensive and representative, we engage in discussions with the National Tuberculosis Program, the Global Fund, and other key stakeholders. Many of you participated in these discussions last year, and we will again be undertaking this process early next year. So look for an invitation soon. Developing this annual roadmap helps generate consensus and alignment on Ministry of Health and USAID supported activities, as well as those of other donors, and it increases transparency and accountability on how our USAID tuberculosis funding is being used. But building sustainable programming also requires building capacity. And to do this, USAID in Ukraine is investing in 3 areas. The first is direct agreements with local non-governmental or civil society organizations to implement locally generated solutions. In fact, just last week, we signed an agreement with a local organization to do operational research. The second area we invest in to build capacity is embedding advisors in government structures. These advisors help develop systems for more efficient operations to increase long-term sustainability and build capacity. Here in Ukraine, we have a senior monitoring and evaluation advisor embedded in the national TB program, and we're currently recruiting for a second to support COVID TB mitigation efforts. And our third way of investing in capacity building is short-term technical assistance, which USAID is providing in Ukraine through our 5-year Support TB Control Efforts in Ukraine activity, which is implemented by PATH. Before the COVID-19 pandemic, Ukraine was making measurable progress against TB in reducing the incidence of TB and in improving access to quality healthcare through the ongoing national health systems reforms. Unfortunately, COVID has put Ukraine and many other countries a few steps back in meeting the high-level TB targets. USAID, along with the Global Fund, have increased our financial support to provide Ukraine with extra opportunities to recover from the negative impact of COVID-19 on TB services and to build a stronger platform to sustain the TB response. This national dialogue and other similar forums are an important opportunity to review, discuss, understand, and coordinate the efforts of all partners that are working in and investing in the efforts to end TB. We have enjoyed and learned from the conversations already had today and look forward to more this afternoon as we all work together to support Ukraine in its efforts to reach every person who is infected with TB, to provide treatment to those who need it, and to prevent the spread of new infections. Thank you.
Thank you very much, Larissa, for this inspiring talk and support of Ukraine and our program and healthcare system. І зараз я хочу запросити
And now I'd like to give the floor to the representatives of other organizations. We keep saying that TB is not just a medical problem, but it's very important to discuss which type of assistance is the WHO giving us, because a large component of fighting tuberculosis successfully is granting high-quality medical assistance to patients. And I'm giving the floor to Mr. Georgy Dymov, national expert on tuberculosis of the regional WHO in Ukraine. Thank you very much. Good afternoon, dear colleagues. Thank you for the invitation. I'd like to mention that my colleague's presentation included the 3-stage WHO assistance that is done on global, regional, and local level. On our level, on WHO in Ukraine, we'd like to mention that we are granting complete support to the national TB, virus hepatitis, HIV, and AIDS within the framework of the global strategy. As we've mentioned today, the most important indicators in implementing this strategy is a decrease in the morbidity level for TB compared to 2015, decrease of the absolute number of deaths, increase in the efficiency of treatment, and promoting inpatient treatment for TB patients. The key role on the NTP technical assistance from WHO is in implementing the project of the Global Fund to keep rolling for decreasing the load on the medical system of Ukraine from TB. So our role includes the assessment of the national strategy on anti-TB, HIV/AIDS, and hepatitis, assessment of the national program, improving the quality of treatment is monitoring and evaluation, the technical assistance in development on human resources in the anti-TB service, access to systemic accumulation and analysis of data, improvement of the laboratory tuberculosis service by involvement of new diagnostic methods, their popularization in TB clinics in Ukraine, providing the high quality of anti-TB medicine, introducing new non-injection and short-term modes of treatment, and giving access to these modes. Help, assistance, and provision of the key services in this sphere during COVID-19 pandemic, and coordination of WHO's activities on all country levels. Thank you for your attention. Thank you for the speeches, for the support, for helping form our strategy to reach our goals effectively. But the purpose is, how can we achieve them when we provide services on community level and bring them to the people? And a very important role in this sphere belongs to the Red Cross in Ukraine. And I'm giving the floor to Ms. Zoya Pogorila, the National Coordinator of HIV/AIDS tuberculosis in Ukraine, to tell about their activity. Good afternoon, dear colleagues. Thank you for the opportunity to join you. The chartered activity of the Red Cross Ukraine helps the country overcome the difficulties in this sphere. So for quite a long time, our organization has been participating in fighting TB and HIV problems in Ukraine. At various times, we have been granting services with assistance and social support for TB patients, psychosocial support for the patients and the people who are close to them. We do in-home HIV patients and drug users, and we also raise public awareness about HIV and TB threats. In some regions, we are continuing to work to support TB patients within USAID and Global Fund projects. Within 2021, information and social support covered almost 16,000 people. By doing this work, the Red Cross, amongst others, uses the principle of unbiased activity. So we don't differentiate by race, religion, class, or political views of our beneficiaries. The COVID-19 pandemic made all of us rethink our approach to coverage of vulnerable groups of population. COVID did a huge impact on the accessibility of our services, and Ukraine's Red Cross has more access to communication channels, including the social platforms, social media networks, for more efficiently reaching out to vulnerable people. The role of the Red Cross is to do awareness raising about the problematic issues, and the efficiency of such activity needs constant coverage of a large number of people, and that can be possible thanks to our volunteer network that we work on expanding. A vivid example of innovative approach is the education training module for HIV, TB, and hepatitis in first aid program within this framework. In 2020 and 21, due to pandemic limitations, 70 trainers and instructors throughout Ukraine, during their trainings, they were covering this new topic of HIV, tuberculosis, and hepatitis, and Over 15,000 people had the chance to this year. We have received the European network of a Red Cross on HIV and tuberculosis and covered over 70 participants, representatives of national councils, of national Red Crosses and Red Crescents of the European region, the Transcaucasian region, and Southern Asia. So they shared experience mutually as related to tuberculosis and using innovative ideas and success cases and good models in their practice. Of course, we're part of the International Red Cross movement, and we'd like to highlight the role of the International Red Cross Committee that is working on logistics to deliver testing systems and treatment for diagnostics and treatment of TB. Another partner of ours, International Federation of Red Cross and Red Crescent Communities, in September 2021 signed an updated agreement on cooperation with the WHO that includes commitments to fight against TB and HIV together. Hopefully, this important step will bring even more attention to solving the problem of TB in Ukraine. Our speaker is breaking up a little, but so I'm happy to answer your questions, if any. So, summarizing, I'd like to say that this is our powerful network of regional and district organizations. The volunteership potential will continue working, and we will support the state activity on fighting the TB epidemic, even in the most remote corners of Ukraine. Including the TB fighting topics into the sustained usual habitual spheres of work, will continue them expand. I've once heard that take 1 0 out of the budget and you'll get much more creative. This is what happened in we included that into the first aid trainings that allows us to inform and raise awareness for the population on problematic issues. Thank you very much.
Thank you, Zoya, very much for such interesting and useful information. And now it's time we move on to another round of speed presentations. And I was joined by Pavlo and a colleague of mine, Olga. And now I give floor for next panel discussion. And we invite our next round of panelists. Yes, we are moving on to a very important part of our discussion of overcoming tuberculosis in Ukraine. And I would like to say that without civil society, without people who were directly affected by tuberculosis and who do everything to overcome the epidemic and support patients who were affected by tuberculosis in Ukraine, without them, the state would have been powerless. So we are talking about this interaction and cooperation between the state and civil society. And I give floor to Olga Klimenko. But on behalf of the Ministry of Healthcare, I would like to say that the ministry as the leading body in the system of central executive body, which is responsible for development of state policy on tuberculosis treatment and implementation. We are very grateful to you personally for your contribution and to you should be an example for all active representatives of civil society because you assumed this role and became the national leader. And from myself personally, I am glad to see you and that we met and worked together. So I give floor to Yana now. Yes, this panel with civil society will be moderated by our colleague Olga Tsvili, but given that tuberculosis is very important and that is why we need an organization that really represents the patients who encounter various obstacles, various factors that prevent us from combating tuberculosis. So we are very proud that we have organizations that became real drivers and do more than they can actually, being very capable organizations. And you remember examples from history when civil society stood up to fight for their rights, like AIDS patients and other patients. They required decades, but in the sphere of tuberculosis, this process was very rapid, and that would have never been possible without a real leader who brought together all these organizations and adding personal charisma and impetus for the whole process. We appreciate it very much, and we are grateful for all their actions that they identified for us as implementers of the national program, and we hope that in the end we will talk less about tuberculosis but more about things that make us happy in our everyday life. So thank you very much again for all the cooperation that we had with you over all these years. So we give floor to our moderator, to the head of the regional center of Dnipropetrovsk. So we now are going to present you another evidence of success of cooperation between local councils and civil society. And I would like to remind you that on December the 5th, we had Ukraine celebrated the Volunteers Day, and on behalf of the head of Dnipropetrovsk State Oblast Council, I would like to present this certificate of appreciation to Olga Anatolievna Klemenko, head of the Oblast organization TV People Ukraine, for her personal contribution in development of volunteer movement, her active position, and congratulate her to the International Volunteers Day. And now, Olga, over to you. Yes, that was a wonderful beginning of our rapid presentation session. And now I give floor to Olga Klemenko, chair of the board of TB People Ukraine, CSO. Ola. That's unfair. I kept my tears for the entire event. And give me a minute, please. So, first of all, as a person who became a face of a patient or organization in Ukraine, the person who defends or protects the rights of people with tuberculosis, on behalf of our organization, I would like to thank everyone, patients, social workers, other organizations, chief doctors, and physicians We are grateful to everyone who understands the importance of our community and who realizes the time has come to change our attitude to many issues that for many years were postponed and were not discussed. And as Yana said, TB people Ukraine grew rather rapidly because that was necessitated by our conditions. We did not have time to warm up, and every year we think that we've achieved so much, and next year we will be working on building on it. But then next year comes and something happens, some apocalypse happens, and we understand that all plans were ruined, everything is decomposed, and we have to do something again from scratch. So, despite all the political process on that take place in Ukraine and all the relations between patient organizations and a dialogue, we managed to preserve this national dialogue. And this is now the second event that is organized at national level. And yes, we continue losing people, and every day people die from a curable disease, but still we see a motivation in some improvements that we did achieve and in the changes that we were able to bring about. So, Natalia, I will not take too much of your time. I'll finish by saying that it is extremely important for the entire team to feel appreciated. And it's so important to say thank you. So on behalf of our entire community, I would like to thank you for partnership, and lives go on. Life goes on. Thank you. Oh yes, our heartfelt gratitude for you, and I will introduce other participants, and then we will pass the mic for our brief presentations. So first presenter sits to the right side of me is Yuri Lazarevich, who represents the network called 100% Live, and he will be followed by Yulia Kalancha, Executive Director of International CSO of European Platform for Fighting Tuberculosis. Then we'll have Zahid Islam, representative of the Public Health Alliance CSO. And we also will talk to Ms. Dravnitsa, director of the PAS project supporting a fight against tuberculosis in Ukraine. And now I give floor to Yuri. Go ahead. Good afternoon, everyone, and I'm happy to represent the network 100% Live. And it is very important for our organization to provide for or to ensure high quality treatment to preserve lives of people. So we pay a lot of attention to social support to the patients, and the Global Fund of Social Support covers a lot of patients, but we continue and support them in the forms of our advocacy activities, providing social support. And there was a great breakthrough in Ukraine concerning medical support, but social support should be lobbied, and rights of patients should be defended. And there is a secret that our organization has, because during the last strategic planning session, we decided to strengthen our advocacy effort in the sphere of local budgets for funding social services at the local level. So I'm very grateful to representatives of local self-government body who joined us today, and I'm sure that working together we will be able to provide necessary services to people and stop the tuberculosis pandemic. Thank you. Thank you, Yuri. Working at a local level is extremely important, and we've talked about it a little bit today already. And it's extremely important both for the public sector and for healthcare professionals and coordination of their effort, as we all know very well. So it's my pleasure now to give floor to Islam. I, uh, good. Good afternoon, and I will speak English.
So I will speak in English. Thank you. So first of all, I think congratulations, Ola, again for such an honor. And I think we value our collaboration and partnership with Olga and all the partners. So today, I think our main discussion is about how we are engaging with accountability and UN high-level meeting, as well as the responsibilities of countries and all. So, I mean, from the Alliance perspective, we have been working on tuberculosis for quite some time in Ukraine. And one of our key activities in the tuberculosis is to kind of, supporting national program with case finding, and as Network mentioned, also psychosocial support and providing DOTs, including people-centered care that we provide. So that is one of the key activities that we do. But when it comes to the accountability and multi-sectoral accountability framework, I think there is much better role that civil society can play beside what we are just implementing. So one of the key issue would be to actually ensure that communities, not only that we are civil society alliance network at the national level, we have principal recipient of the Global Fund. So we have some, I wouldn't say influence, but we are engaged in the national level. But at the same time, there are so many civil society organizations in the regional level which maybe do not have a better understanding and engagement in the national dialogue. I think we need to try to bring those also into the national dialogue so that we can have a consolidated approach. So everybody can actually speak or say what they want to say and engage into the planning and designing of the program. So I would think that if we can do that, civil society can play a better role in designing and also implementing. When they go to implement, they will have a better role better way to implement the program. And another thing would be actually to have, I mean, we talked about in many different forums, I think community-led monitoring, right? So what community-led monitoring would do, because it would enhance accountability for the government as well as the donors, whoever is implementing the program, so that communities can monitor and also ensure that programs are implemented the way it's supposed to be. So I would ask everyone to actually not only engage, I would say meaningfully engage means we discuss, we agree, and we take that into account what communities bring forward. And we would have many occasions, communities discuss it, put the issues forward, but eventually when the plan is made, these are not taken into consideration, right? So we need to make sure whatever discussed here, it should translate into sort of a strategy and implementation. So therefore, I would like to actually ask everyone to kind of work together and as a partner, and we are in the national level as well as we work with the civil society throughout the country. And so we will be working together, and I would like that we collaborate and partner together, and at the end we should be able to actually achieve the goal of 2030. Thank you.
Thank you, Дякую за header.
Thank you. And a very important accent on the role of communities that we've just heard is very true. We need to make good use of any opportunities to build dialogue and share our understanding of local situation to the national level. We've got powerful anti-TB players here. The PAS organization, represented by Hunta Travnica, she has a lot of experience in implementing anti-TB programs in Ukraine, and I am happy to give her the floor. Thank you very much. I will speak in Russian if it's okay. And they told me you need a blitz, a very brief, a very quick description. I'm happy to present our organization represented. We've been in Ukraine for over 20 years. At the previous USAID-funded project, we helped procure a new medicine. The next project funded by USAID is coming, and we're in our third year, and we're helping in various aspects. Diagnosis of TB, latent TB infection. We support PHS in implementing new modes, new medicines. We work very closely with NGOs, and of course we fully support what Yana and other colleagues said, that tuberculosis is absolutely not only medical problem, but like 50% of it is medical. Support to access of quantiferone, the sequential diagnosis technique is being trained on in the National Reference Lab. I mean, the TB program is medical, in the medical sense, is well equipped. It's got the entire toolbox. And all of our partners, and we as well, pay attention to other important aspects. During the previous session, we've discussed raising awareness and including the TB topic into the school curriculum. So anti-stigmatization and aiming at teachers as well as students, so that our the new generation stays aware. And about this art contest, I love this idea too. We will continue. We will announce this anti-TB contest, which will help also fight stigmatization. We also use reform of administrative and healthcare sphere to help fight TB. We've got a great example. We started with Chernihiv region, and the project also supports mobile X-ray screening. We're supporting the population. We're doing TB screening, and we've seen that a lot of study has been done, but it's not aimed, it's not purpose-oriented. So our team started cooperation with the amalgamated community in Chernihiv region, like a pilot project that will be happy to show our first experience. So good luck. If we're talking about innovation in the sphere of fighting tuberculosis, we're talking about PAS. And of course, if we are talking about implementing European experience in our region and in the region of Central Europe, Central Asia, Eastern Europe, if we're talking about the European coalition, fighting coalition, now I'm giving the floor happily to Julia Kalencha. Thank you very much, Ola. Dear colleagues and participants of the National Dialogue, I'm happy to greet you at today's event. And the intersectoral cooperation and accountability, MBPTB, that we're talking about, is a condition for the country to fulfill the accountability it has undertaken for UN inside the country, and on the level of a more larger regional groups is participating proactively in implementing it on all stages. And Ukraine has become one of the first 5 countries of the region, Central Asia and Eastern Europe, that is using WHO assistance, and under the leadership of the Ministry of Healthcare, they have performed initial evaluation and have studied the involvement of various sectors to fighting TB in Ukraine. And the results of this assessment became the basics for the further drafting of the roadmap and intersectoral cooperation and accountability. So this was a very responsible stage to make sure we understand clearly who needs to do what to eliminate TB and who's doing what already. Perhaps you know that this happened thanks to in accordance with the 3 lists of the relevant issues. So the state institutions and bodies were contributing, the civil society associations too, and third element was how strictly are the WHO rules upheld in Ukraine. And so they assessed how TB people in Ukraine are contributing to that based on the second list. This meant evaluating how the communities and the civil society associations are participating. And this document contains specific recommendations on how to engage the stakeholders to fighting TB. And this was implemented in was reflected in the roadmap, which is the next step of the anti-TB program. And we are looking into that document on our national dialogue today, and this document can be the key point that helps fight TB in Ukraine. The communities and the civil society that are facing TB problem have received an important role on the stage of designing the roadmap and on the stage of its implementation. But we need to remember that regular and efficient activity of the civil society and the communities on all stages of fighting tuberculosis, starting from diagnosis to the treatment, cannot be free of charge. So the country needs to improve the standards of supportive services given on the level of local amalgamated communities, and we need to launch a fully fledged social contracting mechanism, and that will open a wide public discussion of the roadmap that has already started in Ukraine. Another very important element is starting the evaluation on the highest level once a year with the participation of the highest top officials of the country, will represented also by the stakeholders and the civil society members. They will assess and evaluate the progress of the accountability of our country, of the commitments. And we need to decide which state institution will become the platform for such evaluation. And to sum it up, I'll say that it's important to start the dialogue today and to continue that only by combining our effort, we will strengthen and reinforce the anti-tuberculosis initiative in Ukraine and in the region. Thank you. Hopefully the topics that Julia has just mentioned, the intersectoral cooperation and accountability, will be discussed during the open dialogue that is going to happen after lunch. And these ideas will be implemented in the resolution of our dialogue and will become part of the roadmap that Julia mentioned. Also, please note, the participants, online and offline, that in online we've already launched a Google form questionnaire in the chat. Please, if you haven't opened it yet, please take a look. There's a Google form with questions and your responses will help us build the information database to aggregate and reflect your vision on TB situation at a certain direction. Also, if you're here with us offline, please scan the QR code. They will be all over the room. Please scan this code and go to the Google form, fill it in. It's very important for us to have this, to share your opinions. After lunch, we're having an open dialogue with everyone present, and to keep all of the topics covered, the questionnaire serves specifically this purpose, so please fill it in. Thank you very much once again to the participants of our SWIFT session. It's an extremely important component and a necessary condition of sustainable development and a stimulus for the state to pay attention to a platform for innovation and a sustainable fundamental for our effort in fighting TB as the civil society sector and the government. So we are going to lunch. We have 1 hour left, but please, after lunch, please come back to the hall, to the room, because we have a super important topic, the mechanism of multi-sectoral accountability. And back when we were communicating with the participants, we kept thinking, how do we say more simply what we are supposed to to work on? We need to build the system called From the Patient to the President. It depends on all of us, how involved we are in forming this system. It will improve the position of all sectors. We have 1 hour. We're not taking away your lunchtime, but please be back. So we have flip charts here. 1, 2, 3, 4.
Я думаю, що ми пропонуємо по порядку розташування питань.
It's just presenting by the order of issues. We are talking about social economic determinants. Yuri, please. Please use your microphone. Our group have been working. Please help me decipher low socio-economic level of life. Socioeconomic determinants and factor of the spread of tuberculosis in Ukraine. This is the context that will define our store. Another group helped us. Low socioeconomic quality of life in Ukraine. Okay. Low awareness about morbidity risks, symptoms, treatment, prevention, stigmatization of TB generally, employment, treatment, education. We described the entire number of problems. The long and unfinished reform of the healthcare system. So there are many questions to this.
The additional risk is presented by the ongoing war and the declining economy. Plus, we have a low level of trust in doctors and lack of systemic and a consistent approach. And then we have a low level of awareness in local communities and information work in the communities. So we would like to add that we are not talking only about the low level of responsibility at the local level, but also at the regional and national level as well, at different layers of management and governance in our country. Then we also have a lot of discussions concerning unclear provisions specifying the rights of patients and other people, and about those who are responsible for monitoring adherence to human rights. Then we have a lack of comprehensive and full-fledged provision of social services, because we kind of have social services that provide various services to all groups of the population, but in fact that we unfortunately do not have sufficient social support to people infected with TB, and we have such services provided by civil society organizations with donor support, but it will not last forever. So we have to address this issue and ensure that budget funds are allocated for provision of this type of services. Yeah, what do we have in red here? I cannot read your handwriting. So it's a low level of efficiency of implementation. What was it? So, in general, we came to an agreement that the lack of awareness and the mentality, general mentality, is that people neglect regular checkups, and we need some kind of work to improve our work on raising awareness about the need of prevention and healthy lifestyle among the population. So we were talking about tuberculosis in general, but my colleagues told me that Ukrainians, as a rule, do not pay enough attention to prevention and healthy lifestyles. And then we included creating conditions for de-shadowing of the shadow sector. I will explain a little bit about the things we're talking about here. So we're talking about payments for the loss of capacity, and these, even if a person receives this payment, this person can go back to the workplace, and if a person is not officially registered as an employee of some organization, then the person cannot receive respective payments, and that is what we mean by de-shadowing. Okay, thank you, Dmitro. And if you have any questions, you are welcome to ask them. And I would like to ask our online participants of the dialogue that they can leave their questions in the chat box, and we will read them out for our speakers. So please be ready. So sometimes we'll have questions for you later, and you'll have to go back and answer those questions that are that come from our online participants. But those present here, do you have anything to add or to ask or to clarify? Okay, Yuri, yeah, what about the work of our group in general? Anyone would like to comment? That was good. Okay. Thank you very much. We hope we will have more questions from our online audience, but now we move on to our second group. And Ola, you are welcome. Well, we were thinking about providing some practical input based on the results of a discussion in our group, and that could be used for developing our roadmap for Ukraine. And concerning our question, it was about efficient tools for achieving a high level of political commitment and mobilization of local authority and the public. And we were almost unanimous saying that the first thing that we should start with when developing political commitment was communication with the top level authorities, and the efficient tool for that would be identification of priorities in the sphere of combating tuberculosis. We need a presidential decree and a focal point, and that Pavlo told us how we can strengthen our activities there. And then we need a designated responsible person who would ensure implementation of the presidential decree. Then we need a resolution of the Cabinet of Ministers concerning development of respective work plans by each of the ministries, and a similar approach would be here that the responsible persons should be identified, and then we should ensure exchange of information in order to coordinate all our activities. And performance indicators here would be the establishment of a timely identification system in Ukraine, establishment of a system for ensuring media coverage of the process and developments that take place in the country. And then the third component would be development of educational activities for different groups of the population, plus resocialization of the population in order to level out and to create respective conditions for supporting people who have a say in economic factors present in our country. So for the performance indicators, we were trying to see how we can measure or what should happen in the country after adoption of the presidential decree. So by performance indicators, we mean which changes we should see that would demonstrate achievement of this or that indicator or this or that goal. Then we were talking about identification of responsibility and of bodies that would be charged with adopting the adopting respective documents, and non-compliance with those documents would entail dismissal of the heads of respective units and departments. So that would mean they're ensuring their responsibility or liability, because without that we cannot force them to ensure implementation of political decisions. So if this respective decision is made, this political decision has to be implemented, and if they fail to do that, they need to be, or they have to be dismissed. The fifth point is a more focused, more targeted. That is very practical one. That means identifying certified facilities that would be responsible. Thank you very much, Ola, especially for being so practical in developing very focused proposals, so that's easier to write them down in a way that will make it possible to include them into respective documents. Maybe there are any questions? Nothing from online and nothing from participants in the studio. Okay.
Christina,
I was talking about the resolution that would identify medical criteria and responsibility or liability for non-compliance with these criteria from the part of local self-government bodies responsible for healthcare sphere. So there are some criteria, but the current criteria do not cover tuberculosis. Yeah, thank you. And I like your idea about liability and responsibility, because we were talking about awareness raising and responsibility of local communities, and we were thinking about a law that would provide for social liability for identifying the needs and providing social services. So we were thinking about the law, but we did not think about who would monitor implementation of this law and compliance with this. Fortunately, we do not have such liability, and it's very good that you mentioned that there is a need to provide for such liability. Yeah, this resolution will apply only to the heads of oblast state administrations and city administrations in Kiev, in the cities of Kiev and Sevastopol. So that local self-government, you cannot dismiss an elected head of a local self-government body. So that's a very subtle mechanism, because a resolution can only recommend that this person should be dismissed. No, we thought about two mechanisms. For instance, we have a clearly specified political will enshrined in a resolution of the cabinet or a presidential decree. So there are two documents that need to be implemented, and then responsible persons should be identified, and if they fail to do this, then this person should be dismissed. So we identified it in a way of a practical criterion, because we say that in the sphere of combating tuberculosis, we need this or that measure to be taken. So we think that this criteria should be included into the normative document specifying or outline respective tools.
If it's fundamental, then you do realize that this is an instrument of hearing the community, hearing everyone. Unfortunately, we don't have that. Honestly, I don't see it happening practically. But if the local government, the regional authorities understand that they will be fired for non-compliance, it will boost their motivation. It's also making the situation personal. As of now, there is no such thing as personal responsibility here. I take it that you mean the leverage for firing officials that don't subordinate to a vertical. If the presidential decree defines the responsibility, it will be a leverage for the regional authorities. and they will be more motivated to build a system. I'm just really bad with figures. I don't remember them, but I can add a wonderful decree by the Cabinet of Ministers from the year 2017, number 640, that regulate the monitoring of the officials' activities, which includes the A, B, C category of officials. And it says that if a state official has his work evaluated as poor, that's a reason to demote him or fire him. So the people responsible for TB, for the medical sphere, continue using additional criteria for their activity. Thank you. From the President's administration and the head of amalgamated community, let's leave both of these documents. I just googled Decree 35, and in fact it's an experimental one, and it relates only to Kiev and Sevastopol municipal administration. So we can write a plan so that the entire decree number 35 fulfills this experiment successfully, and then they can scale it to the regional administrations. Are there any other questions, comments? Thanks. I thank the group for their discussion, for their insights, and I thank the speakers. The third group will present the possibilities and barriers at implementing the financially sustainable measures of fighting tuberculosis on the governmental level. As for the people who face the problem of tuberculosis and the people who surround them, we have had a heated discussion. It's a little bit chaotic, but I'll stabilize it and give you the information we've been discussing. Today we have assistance packages that fund the medical institutions. We have local self-government who are allocating funds for certain needs of the communities. There are grants, technical assistance. If we're talking about what is not working well and how do we fix that to improve the quality of living and remove the barriers, then on the national level we should have a normative document like in 2016. The document on cooperation between the Ministry of Healthcare and the Ministry of Social Policy. It put forth a list of services. When we talk about assistance or local budget allocations for TB patients, we start this discussion that the Department of the Social Policy says that it's a medical service and the healthcare facilities should do the procurement, and the letters say that it's a social service, and so they start juggling, they start throwing the ball at each other, and nobody wants to take on the responsibility. So they define the mechanism in order to understand what's going on locally. We also discussed the document that on the national level there are organizations that must be funded from the state budget. That means the organizations that help people with disabilities and organization of the participants of the military conflict. That's why we have discussed the idea of creating a list of the services that must necessarily be funded on the regional level or municipal level, so that the TB services get funded as well. Because what we are lacking is the mechanism of convincing the local state administrations that we need to provide for procurement, for assistance, and other services that are necessary for our patient to make it easier to diagnose and cure tuberculosis. We've also discussed social assistance, but if we're talking about diagnosing, the primary level is not working in that sphere. And as an instrument, if we are discussing the NHS in the primary healthcare centers, we should have specific monitoring and a bonus motivation. And this scheme, this algorithm must be very clearly set forth so that the medical facilities understand what will be the result of failure to comply with the screening or questionnaires or diagnosis. So next we discussed that the majority of people who have TB, part of them, are people who are socially vulnerable or tricky, complicated groups, and in 40-50% of these people don't have declarations with their family doctors for a number of reasons. Didn't find the doctor, didn't find the documents, had no time. So for that reason, we are talking about introducing into the decree, into the package when the declaration is taken. We have the identification list should also include the demotion certificate from the job and also the certificate of a homeless citizen, so that the healthcare centers can identify that person for inpatient services. If we're talking about TB, that was a solution for that problem, to support these people, to not let them get completely lost. Okay, there's another issue on throughout entire Ukraine, restoring the documents, the ID. When you restore your documents, there is a fee, a state fee, that one has to pay, and sometimes that stops people from restoring their identity officially, so we need to cover that payment for them. And another thing we've been talking about is we have a lot of centers that grant help to TB patients who are in a very difficult financial situation, and state administrations are not participating a lot, so they are covering some of the utility costs. We can see the entire picture of what's going on in Ukraine. It's difficult to discuss the funding, and also physiatrics also carries the responsibility on payment of the pensions, of the retirement payments to the doctors who had been working with them. So they need to pay that from the National Healthcare Service funds. This must be regulated on a national level to put the responsibility to the pension fund to alleviate this burden from the hospitals who are already overloaded. The National Healthcare Service must define the clear indicators about TB screening, for example. for treatment, like our donors give us indicators and we receive funds or don't receive them by the end of the year. The same goes to regulating this mechanism. At the same time, we have this national service providers, aggregator. They should have the same indicator to keep these vulnerable people within the social services network. That's how we provide both treatment and social assistance. And this algorithm, this mechanism will work smoothly, and they will not try to burden each other with this responsibility. And I've also mentioned that the list of the obligatory services to be funded on the local level will be social medical assistance to TB patients. On the national level, there are official documents and mechanisms that we can use and procure services on regional and municipal level. The lower the level, the more difficult it becomes compared to national level. There are barriers, there's lack of understanding. People keep saying that it's not, these are not priority groups, these are not so important. So in order to regulate and to overcome this barrier and to increase the treatment and diagnosis indicators, we need a specified and officially approved list of services. When we launched the services in NHS, in PHC, we've discussed the advanced package of services on the local level, but nobody approved the list. It was just a recommended non-obligatory list, and each region did what they saw fit. So this procurement does not happen in all regions, and if they are, these are just maybe 1-2 regions who are not adding to the sustainability.
Yeah, I have a comment and a suggestion, if you don't mind. I agree completely that with the fee, the state fee is a very reasonable idea, but then we should also think about administrative liability for the lost military ticket and a lost passport. Then, in addition to the state fee, you also have to pay a fine, and the amount of that fine was changed to 1,700, 1,800. So, and then when a person is placed in a social facility, the person is also registered there only after the respective fee is paid, and then we will discuss it later, maybe when we will be talking about the list of bylaws. And as the second point is a little bit controversial and reflects my personal opinion, in my view, we cannot compile a list of mandatory services that has to be purchased from local budget, because we have different regions and different resources. So let us focus on the existing tool, which is not efficient. And I'm talking about the procedure for needs identification, because the way we calculate and we identify the study needs in the regions is not a proper way in which it should be done. The indicators that Natalia mentioned, and when the social national service will be looking at these indicators, that will reflect the needs to a certain extent, and then it will give us an idea of which needs we need and how they have to be satisfied. Because I'm a member of a public council on the Department of Social Policy, and at each meeting or session, we have a certain group of people talking about activities of the group, and they require special budget line for their needs. And as a result, this service is has this different names, and then those who name this service, they have no idea about how it has to be calculated, which rates should be set, and how the standards should be applied. For instance, we have a homeless person who was released from a prison and has an HIV. So which standard should be applied in this case? So we have this total overlapping in numerous occasions. So I think we should look into these needs identification process, but it's just a suggestion from my side. Yes, I would like to respond to this needs identification process. Really, in the regions, it's not organized properly, to put it mildly, but if we look at the table that is used for needs identification, you will see that these target groups are not even included there. So the groups we are talking about and whose needs need to be identified. But this mechanism, maybe it should be added to the list of mandatory services. But, well, we did not have enough time, but we were not talking about the list of services. Actually, here we were talking about the list of categories of people, because we cannot force anyone. Communities should have some document that would regulate all these categories of people who belong to the primary focus categories. Yes. I wanted to add something, and I agree with my colleague about this formulation of the definition of needs identification, because again, the person should know that they have to organize this process properly, and if it's not done, then there's certain liability should be entailed or envisaged, because in our practice we had situations when people were unwilling to add certain needs to the list, because as they told us, it's too much, we will never be able to find funds to cover these needs, and then that will lead us to a lower position in the rating. So we have to address this problem and improve this table or list of categories and include the socially risky groups, and ensure primary provision of services to these categories. Yes, and there is a need to amend order number 54 and ordinary 2826 and order 49. These are the orders or resolutions regulating work with homeless people. And these documents need to be amended because they were adopted before the beginning of the reform and decentralization process, and they cover a lot of areas that no longer exist. And then the centers have to be created, and the municipal facilities should be identified that accept and work with people having TB, and sometimes these people are simply lost and not covered by regulatory framework. Thank you. Maybe we have any comments from the audience, but we have a discussion already, and we have an online comment coming for group number 2. That's a comment left by Sviatoslav concerning the discussion about activity or sanctions to be used for non-compliant officials. So the question is whether it would be really motivating factors to change their behavior, because dismissal is a bit of drastic measure. Probably different forms of liabilities or motivation or impact should be developed, because dismissal should be the ultimate sanction that should be applied. Because we are talking about dialogue and partnership, and of course we can break something and force someone to do something, but what the result would be, Our aim is sustainable process, so we have to talk to people to persuade them and achieve common vision. Yes, if I may, because the comment was for our group, thank you very much for staying with us, Svetoslav. And it's not only dismissal that can be applied in order to achieve our result, but one of the key obstacles in Ukraine today is that we know how to motivate people in general, but those who are responsible, the heads of some bodies, administrative or executive bodies, they do not need any motivation. We had those examples in the local communities and state administrations showing that if people really care about public health, they do not need additional leverage, additional motivation. But if you have no mechanism or no tool that you can use in order to change their attitude, for instance, in a region where all documents were adopted, orders and resolutions were adopted, but they are not implemented. In that situation, I saw a lot of signs showing that those regions that achieve certain success are popularized at the national level, but regions with a high level of mortality are not punished in any way. So what we need is this comprehensive, all-sided approach to changing the situation. Thank you for your comment, answering an online comment, and we move on to next presentation that is about elimination of legal and gender obstacles on the way to ensuring equal access to high-quality services, anti-tuberculosis services. Yeah, we had a very good group with representatives from different sectors, and you will hear the situation in prisons and homeless and other people as well. So we had several suggestions. We only included general comments, and some of them were already mentioned by previous groups, and we will talk about the rest. So the first, we have to expand our work with former inmates and their work with social activities of social workers. We think that if a person works with inmates or with HIV infected, and we think that these social workers can also go to penitentiary institutions and work with tuberculosis infected inmates there. In order to make it possible, we suggest that a resolution of the Cabinet of Ministers should be amended, and provision should be added there on additional payment for a social worker in the amount of 25% of salary, for instance, and for that aim, and an inmate can be involved for provision of social services, social support in prisons. Then we envisaged provision of funds from various resources, and then that would enable such social worker working with residents of different territories. The Ministry of Justice is thinking about creating multidisciplinary penitentiary institutions, and then all inmates in the region will be kept in the same prison on the territory of the oblast. So what we suggest with regard to other aspects is to provide open statistics on gender, broken down by gender in the TB sphere. We have specialists responsible for gender disaggregated statistics in the respective state statistics service, but in fact the data related to tuberculosis and treatment are not gender disaggregated. So what we suggest that this information should be collected and provided in this form of open data for each oblast. And then We also identified the responsible entity for each activity, and for this activity we identified the Ministry of Healthcare. Then we suggest that some bylaws should be amended, for instance, for convicted individuals and those who were released from prison should have a special procedure for ensuring their access to treatment, because convicted and released and imprisoned individuals do not have that access to the developed package of services. We have no idea which schemes or algorithms are used for ensuring their access to treatment. And when these individuals are released from prison, we in fact interrupt the continuity of the process of their treatment. We have data according to which 26% of those who were released from prison and infected with tuberculosis, they continued their treatment outside prison, but they have no idea where to go, and no explanation is provided to them, and no declarations are signed with physicians. So we have 1,500 prisoners who signed declarations, but they have no access to their family doctor for the time they are in prisons, and they have no access to the package of services. So family doctors receive payment for these 1,500 people, but additionally money is paid for their treatment in prison. So we have this double funding burden. And then if we talk about all social guarantees, we have to mention another problem. And when a person is employed, and Olga mentioned that if person is employed, the person should have paid sick leave but when a prisoner gets sick, they do not have any sick leaves, even if they work, even they pay all the fees, but still they are not entitled to have sick leaves because they're not connected to the respective Ministry of Health system. And there are no conditions to sign direct agreements with penitentiary institutions to ensure that prisoners have full access to the package of services. And the final suggestion is that we should suggest that a system for monitoring and evaluation should be developed and implemented in the sphere of existing legal and gender obstacles, including closed systems. So Ministry of Health, Ministry of Defense, and Ministry of Justice should be included into this process. And we also have centers where migrants stay for a certain period of time, because we were trying to find out how medical services are provided there, and we were told that they have their doctors, but we don't know how the screening is carried out, how tuberculosis is diagnosed, and there is no statistical information about that in open sources. And we suggest that indicators, reporting procedures should be described to enable us to measure these processes. The next step would be a provision of efficient control and oversight and update of information about medical facilities and activities that they carry out, because sometimes we do not have such data as address, contact, phone number, which are relevant and up to date, which a person can use in order to receive information. And we would like that this should be introduced for a closed system as well. And then work on awareness raising should be improved, because at the very beginning of all process, such as a study of the needs, should start with understanding what it is about, why it is necessary, and so on.
So we need standardized education programs on gender issues for medical educational institutions, also for healthcare departments at state administrations. So The unified standardized program was made for criminal justice experts who work with children, and it covers the entire system of movement, and the journey throughout the system. And this can cover the gender aspect of this problem and the legal ones, and break it down by aspects on how to combat stigma and discrimination, and this will allow us assess their competence equally, because the state official, the government official, will be able to undertake this course, to take this course online, and will have clear KPIs. So our last suggestion, decided to stop here. Our last suggestion is including this into a certain plan. It shouldn't be 350 pages. So last one is implementation of interinstitutional cooperation for this education and key rules of behavior for people with tuberculosis and with people who were affected by the tuberculosis epidemics, because that's also a large group of people who need support and supervision of these issues on the intergovernmental level. What we can say is that generally the Ministry of Healthcare and the Ministry of Regional Development will be the key players, and we will help build this mechanism. Comments, please. Thank you very much, dear colleagues. We do have a lot of results, but another important gap in medical assistance, access to medical services, are the patients with no IDs or patients with no declaration and with the family doctor. We need to implement programs on restoring documents for vulnerable groups of population and in various regions. It means we need a different approach, because if it's a Transcarpathian region and the Roma people, is a separate group that needs a specific approach. Concerning the patients that did not sign declaration with a family doctor, we know sometimes it's not because of the documents, sometimes it's because of no possibility of sign the declaration, because the doctor is just not there in that neighborhood, or the family doctors have already taken more people than quota allows them to, or they dislike that family doctor due to professional or personal reasons. So we need to not just regulate this issue on the national level, but see how the programs of social support and assistance are implemented for such people. And this applies not only to the TB situation, but to everything else, so to all other diseases. We will formulate it and put it down to our plan. Comments, questions? Okay. So basically this is the end of our session, and we are moving over to the final stage. Thank you, Ms. Irina, for your presentation. And we invite Ms. Yana to give the final session to summarize and discuss our next steps. Dear participants of the National Dialogue, we can see that every year we keep changing the format of the dialogue, and we are completely sure that next time will be even more ambitious. And we'll be making summaries of our annual work. So this platform of National Dialogue is quite fortunate. It will absolutely be an annual initiative, and hopefully our national, international partners will support us and confirm that these platforms of discussion should exist for to to work on problems on tuberculosis and related problems. We have discussed a lot of interesting and challenging aspects of this problem, and the organizational committee and the initiative group will undertake everything as a basis to continue working on the gaps we still have, so that we have a more transparent accountability mechanism. We're talking about mechanisms of intersectoral cooperation, and we're talking about finding out who will be responsible for what, and we're sharing accountability and responsibility. A lot of things still needs discussion, but we're open to the dialogue. We can hear each other, and that is the progress in our work, in our understanding. We see we're on the same page. There is no argument on priorities. We have the same vision on current problems, and we have a great team. We define how important this dialogue is to engage not only the ministries, institutions, local self-government, but also the public. And we can see how powerful this sector is, and sometimes we're talking from various points of view, but we mean the same tasks. And it's also very important for us. So we wish to all participants of this dialogue to come back with a systemic vision of what we will be talking about next year. And we will have even more consolidated platforms. We've said that we have our National Council with the effective committees and numerous working groups that are working on a transition plan and new strategies. We see the perspective plans on implementing mechanisms of intersectoral cooperation, and one of the next tasks is having a roadmap that will finally lead to a decision from the Cabinet of Ministers or the Presidential Office on defining the responsibilities, roles, and the system of transparency. So we'll be back to this issue. WHO mentioned this. We have the roadmap, and finally we'll have to work on that in much detail. We see how many ideas we have already generated. So we are now moving on to the next level of responsibility of fighting tuberculosis. We're counting on all of you. We wish you to be as motivated and inspired and emotional and positive as you are right now. I am sure that in Ukraine, regardless of the weather, be careful while you're driving. We need everyone while fighting tuberculosis, and your effort is very valuable to all of us. And I now suggest to give the floor to the main organizer to summarize, Ms. Olga, to say several words from her side. We are very grateful to the team that made enormous effort to organize this event with the organizational committee, with the financial support of the Global Fund, I'll remind you, and the TB Coalition, through the network to make this event happen. And we are happy to see that today part of you are in the room with us. This is exactly the energy that we need during these online events. The people who are with us, over 100 people, also feel this vibe that we are having here. Miss Olga?
Yes, but I will take a minute to read out the comment from one of our participants saying that we are convinced that together we will be able to achieve our goals. So our participants online stayed with us and they support us. Yes, thank you, Jana. This hybrid format of our events is always increased challenge for the organizers, and we really invited representatives of civil society organizations and WHO participants and participants from other countries, because it's the only possible way for us is to work together in order to find solutions. Of course, the organization process is not always easy, and as we know that today we had more than 80 participants during this day, including online audience. We had more than 50 offline participants in this hall today, and we developed viable proposals that will be included in the respective documents, and next year for Ukraine will be a powerful brainstorming year, because all these solutions will have to be reworded and translated into efficient mechanisms that will have an impact on the further development of this system. I'm personally convinced that if we change the paradigm of situation with tuberculosis in the country, we will be able to influence a lot of developments in the country, because tuberculosis is not a medical problem only, and we have to develop services and ensure equal conditions for those key populations that today have limited access for various reasons to healthcare services. And I know that combating tuberculosis means health of our nations, of our population and our children. So every year we make small steps, we consolidate our effort to achieve a greater goal. I wish you all good motivation, because you have to have this feeling, because you never know the names of everyone we save and we lose, and it's very difficult when you have this negative external pressure and burden on you, which is greater than the feeling you have from being active. I think there were no indifferent people today with us, and I wish you all keep this motivation, because what we do every day, it's maybe not visible here and now, but still it will bring us to such outcome as healthy future for our nation, and you'll have this feeling that you did what you could at the place where you are, and that will be enough to bring more people, make them join us and believe that together we define the future of our country, even if it is through combating tuberculosis. And as a community of anti-tuberculosis activists, we wish that this cooperation will grow, will have a respective center coordinating that, and we hope that patients will also be responsible, aware of their rights, and capable of defending their rights, and not being afraid to talk about the barriers and discrimination. And they should also, and each and every of us should also not be afraid to talk and to discuss the barriers, because through these conversations and discussions we will be able to overcome these barriers. So I would like to thank everyone, the standing committee, the entire team who spent sleepless nights organizing this event, like this public health service, our facilitators, our interpreters, and everyone who took part in this event. It took place, and it's a good beginning of a long story for Ukraine, and I hope that it will continue longer than 2030. So thank you everyone again. And we'll have a group photo now, everyone.